Good morning, everyone, and welcome to this, I think, very, very important meeting for the WHO MPP mRNA Technology Transfer Program. The event is being hosted by the Government of Belgium with significant gratitude from all of us, and the Medicines Patents Pool, thank you again, and the World Health Organization, again, thank you. And most importantly, to everybody who's here, the program partners, the funders, and support organizations, and other supporters, please welcome to this important meeting. My name is Kafoko Zachariah. I'm the director for One Day Africa, One Day Sooner. Our organization is a support organization focused on trying to expedite the process of access of medical countermeasures, even just by a day soon. And I think this program, in many respects, speaks to that objective. Maybe before we get started, just to mention, if it's not yet obvious, that I'll be moderating this session. And as part of that, maybe I can also give some bit of housekeeping guidelines for this meeting. This is a hybrid meeting, so we have some participants who have joined online, and then others obviously are here. And then for those that are in person, the restrooms are the door right behind. You just walk straight there. And then in case, for those of you that are in person here, in case you need to step out of the premises, you need to leave early, please just identify any of the people in this room with the black lanyards, not me. Mine is blue. Identify the ones with the black lanyards. They'll escort you for security reasons. You won't be able to just leave the premises on your own, so they have to escort you and clear you out of the premises in that way. Only if you need to leave early. Otherwise, we wish everyone to stay in this very, very beautiful place. I think as we walked in, we noticed that. We are going to have a group photo, I think just before lunch. So obviously, we would be very happy for everyone to be in that group photo. That may be also captured for history for this very important, I think, vaccine equity initiative. Then at the end of today, there's going to be a dinner, and we shall speak more on that. Otherwise, throughout the sessions, if there are any thoughts or questions that come up, please do take note of those, both in person as well as online, and we shall be looking to accommodate those conversations at a later part of the session. For now, I think it is my distinguished honor to invite for the welcome remarks to our very, very generous and hospitable host, Heidi Rombots, the Director General for Development Cooperation and Humanitarian Aid, Belgium. So, Heidi, please take the floor. Thank you.
Thank you very much, Zachariah, and welcome, dear colleagues, to our Egmont Palace, Palais d'Egmont. Just as I was talking to one of you, this palace actually has indeed a bit of a reputation. This palace is also the place where many negotiations find place, and so journalists are very often at the outside of the gate. And indeed, not that many people in Belgium have actually entered the actual palace, so we're very happy and honored to have this extinguished group of people here in our palace. It is one of our assets that we're happy to share. I believe it is a good place to have the conversation that you're about to have. We are so proudly co-hosting this event alongside with Medicines Patent Pool and World Health Organization. Dear colleagues, Belgium is indeed firmly committed to advancing equitable access to health services and products, not just services, but also products, as they are a key priority of our international cooperation. The efforts also include strengthening local vaccine manufacturing, notably through multilateral efforts, and together with also European partners, and the Team Europe initiative on manufacturing and access to vaccines, medicines, and health technology in Africa. And of course, our European partners are also here today. We commend the South African Consortium, Africaine, BioVac, the South African Medical Research Council, and the South African government for driving forward the program. as well as MPP, WHO, and the program partners for the outstanding work that they have done over the past years. We are proud of that cooperation and the fact that the hub has, with also Belgian biotech companies, has been able to further and progress on it. Because indeed, this program, in which the development and economic ecosystems intertwine to collectively drive forward equitable access to health products. And I'm happy that Mrs. Terblanche will share some of that ecosystem. I think today, in the context of today, it is more important than ever that we do demonstrate the interconnection of our international development cooperation with also economic ecosystems, academic ecosystems, and the learning and the mutual interests that are there. The mRNA Technology Transfer Hub in Cape Town is a prime example of how indeed voluntary transfer of technology can strengthen local research and manufacturing, as well as boosting development, employment opportunities, but also international benefits. It is essential to build additional geographically diversified capacity to produce the latest health innovations. It is a key component of strengthening worldwide pandemic preparedness, prevention and response, as well as strengthening national health systems, the basic of any strong health system. And that is why Belgium is indeed proud to renew its partnership also with WHO's Access to Medicine program, with both the component of tech transfer and HTP, and also access to ecosystem. I see that, of course, our Team Europe colleagues, as I said, they're both present here, but I believe there are also some of them online. And so I will, as Belgium, be co-chairing the EU-AU Global Health Partnership meeting hosted by South Africa in 2 weeks' time, and we're very much looking forward to that. And we will also have the opportunity of visiting the hub in Cape Town, and I really want to extend already the thanks to Afrigen and BioVac for welcoming us, and I'm really looking forward to actually see that partnership on the ground. Before really wishing you a very fruitful meeting, let me share 3 additional thoughts with you from the perspective of international development cooperation. I believe that we all realize and know by now that international development cooperation is under pressure. Budgets are under pressure, and I think for some even more, the whole concept is being questioned. And therefore, I think it is so encouraging to see all of you here today in this room, because this is still what international development cooperation is really meant to do. It is about collaboration, it is about partnership. And so for me, this actually underscores that international development cooperation, international cooperation has a future. And I think the future is upon all of us to build it. Secondly, we also want to, and we're of course part of that reflection as well, we probably also have to adjust and refocus our attention and make a clearer commitment to mutually beneficial partnerships. We indeed want to contribute to diversify manufacturing, as it is indeed also about local ownership. It is about tailoring it to local needs so that it actually, in a wider ecosystem, can strengthen the global health security on the basis of mutual beneficial partnership. And thirdly, this really squarely sits at where also Belgian minister, somebody wants to respond to it, you'll have the floor soon. The Belgian minister underscores our international development cooperation as being part of investing in global public goods. Whatever country is, how rich it is, how powerful it is or thinks it can be, health is not something that can be solved just by one country alone. We have to invest in it together. It is about a global public good. And so for our minister, the global public goods such as climate, stability and health actually really deserve our investment in terms of international cooperation, because prosperity and well-being actually is more than ever also a matter of the prosperity and well-being in other countries. We are no islands, and I'm sure everybody in this room as health experts and working on global health is already convinced of that. Let me just close by inviting all of you that we have to carry that message way beyond this room. I think if I look at international development cooperation, a field in which I've been working for 25 years, I think we have to maybe acknowledge that we've not always been very good in demonstrating the effects for the wider world of the work that we do. And I think this is a warm invitation to all of you to actually carry that message beyond the building, even if you need accompanying somebody to leave this building, widely beyond this building, widely beyond our own national constituencies. But we have to make this a global conversation. We have to invest in global health as it is to the benefit for all, as it is about our common future. And with that, I wish you a fantastic meeting and leave you to the capable hands of Zakaria.
Thank you. Thank you so much for those words. I think there is lots of good points to pick from what you've mentioned. I'll maybe focus more on the global public goods concept. I think public health, as it is described, really is everyone's interest and should be everyone's focus, because pathogens don't look at borders. I think we've learned that so many times in the past, and the COVID-19 pandemic was a stark reminder of the importance of international cooperation when it comes to global public health. I think the diversification of manufacturing capacities also speaks significantly to this program, because this, I think, is one of the key tenets of the mRNA Tech Transfer Program. Diversifying and decentralizing manufacturing capacity, at the same time building human capacity to be able to respond in the next pandemic. I think this is the question or a thought that we had presented during the previous meeting in Johannesburg. If we try to picture the next pandemic, what is going to be different? I think among the key things that we're likely to see that will be different is this particular program. The Global South, the poor countries who have decentralized local access with local expertise that will be able to contribute significantly to the fight against the pandemic, whichever pandemic it is that we're going to be facing. So thank you so much for your hospitality and your commitment to this program, and we are really humbled by that. And at this point, I will also ask for some opening words from Marie-Paul Kenny, the chair of Medicine's Patents Pool. Your floor.
Thank you very much, Zacharias. Excellencies, distinguished guests, colleagues and friends, welcome and thank you for being here. We meet in the beautiful Egmont Palace, thanks to the Government of Belgium, a steadfast champion of equitable access head of this program from the very beginning. Let me begin by expressing deep gratitude to all who made this possible. Belgium, of course, for its support, political leadership, and for hosting us today. Canada, the European Commission, France, Germany, Norway, South Africa, the ELMA Foundation, and all our partners who believed in the vision of technology transfer for health security and sovereignty. Your collective support has shown that real change happens when solidarity drives science. In just a few years, we have turned a bold idea into a working model, building skills, infrastructure, and confidence across continents. Afrigen has developed a platform for mRNA, and nearly all the partners have received the technology transfer. R&D consortia have blossomed in all the regions, and others are also willing to share their technology. We have proven that with determination and partnership, extraordinary progress is possible, even with limited means. But this is also a turning point. We have built something remarkable, but it is still fragile. Without sustained support, we risk losing the momentum, the talent, and the trust that we have collectively created. Phase 2.0 is what will transform this foundation into lasting capacity, ensuring that these new facilities produce real vaccine and therapeutics and remain ready for when the next pandemic comes. We have come this far with just over 120 million euros, a relatively modest investment that has generated enormous success. To secure this future, we now need more funds, but let me reassure you, it will be less than the original investment, a small but critical step compared to what is at stake. The program is not about one region or one disease. It is about a new model of collaboration, one that keeps innovation and equity moving together. We have done a lot with little. Imagine what we can achieve if we continue together. On behalf of the Medicines Patent Pool, thank you for your trust, your partnership, and your belief in this vision. Let us make sure that what we began is not just remembered as a success, but at the start of something enduring, delivering over and over again a global, essential public good. Thank you very much.
Thank you very much for those words. And picking, I think, one, if I may, this is an important program, but I think you make a very solid point by saying that it is still fragile. I think that's something that we should really think about in terms of what that means. We've made, I think, significant progress since the program was launched, but I think the program still needs a lot of hand-holding and scaffolding and support. And through cooperation, as you mentioned, this program will certainly reach the milestones that it is posed to reach. So I think that's a very good point for us all to keep thinking about. This program is huge, it's important, it has a lot of capacity and potential, but at this stage, it is still fragile and therefore needs a lot of support. Thank you so much. And moving on to our next speaker, who's supposed to be Yukiko Nakatani, but unfortunately is not currently online and will be. Oh, okay, perfect, perfect.
Thank you.
You can understand why I wear the glasses, yes. My apologies, Yukiko. Please take the floor.
Thank you very much. Good morning, all. Thank you very much for giving me this opportunity. So, Excellencies, distinguished partners, colleagues, and friends. And I thank you very much, Director General, Ms. Heidi Lombos, to hosting this important event today and for your generosity. And also Dr. Marie-Paul Keeney, my former predecessor of ADG role in WHO. Thank you very much for leading this program. Very strong, powerful leadership for you. Then my apologies, I cannot join you physically today, but wishing you all a productive networking in person at the historic venue of the Egmont Palace. First of all, thank you again, our host, the Government of Belgium, for your generosity and for championing the equitable access to vaccines. And thank our partners at the Medicines Patent Pool, and especially all the partners who believed in this vision from the start. We meet at the pivotal momentum for the WHO and global health. The organization, like other global organizations, is undergoing a significant restructuring. So since I appointed the ADG for the Health Systems Access Data Division June this year, so I'm facing the restructuring. This is a very much painful process, but also we consider this is the opportunity to maximize the operational synergies and also our efficiencies than ever. Then we must all focus our resources where they deliver the greatest impact. In the face of the persistent challenges, our mission remains clear: to ensure healthier populations and leave no one behind. A key focus is ensuring that everyone, everywhere has access to safe, effective, and quality-assured medicines and health products. When mRNA technology transfer program was launched in 2021, there was no mRNA production capacity in low and middle income countries. But today, thanks to your vision and commitment, we are on track to establish a global network of sustainable manufacturers across 4 continents. This is equity, solidarity, and innovation in action. It also sends an important political signal. When governments, science, funders, and industry unite behind a common purpose, we can make access to the life-saving technologies a right, not a privilege. The pandemic agreement adopted earlier this year commits us to sustainable, diversified production and fairer access. The mRNA technology transfer program is a living example translating Article 10 and 11 on the pandemic agreement into reality. It shows how multilateralism can deliver tangible, inclusive results. Your engagement has shaped it into a model that is locally owned and globally relevant. To strengthen global health security, we must move from dependence to resilience, so every region can produce the tools needed to protect its people. With your partnership, trust, and leadership, let us make this model endure as a foundation for a fairer, more prepared world. I wish you all have the very productive, fruitful discussion through this event. Thank you very much. Back to moderator.
Thank you once again, Yukiko, for those words. And you are right to say that in health, we leave no one behind. I think the motto should be ensuring, as you rightly mentioned, that everyone, everywhere has access to safe and effective medicines. I think that's a very key message to pick. And I think with your kind of leadership and determination, this program certainly will continue to move in the right direction. And it's at this point, I think we can get some statements, high-level statements from some of the funders who have been pushing this program, who have been making sure that this program continues to move forward as it should. And first on the list is Martin Seychelles, the Deputy Director General for International Partnerships, European Commission. Martin?
Thank you, Zakaria. Good morning, Your Excellencies, distinguished ladies and gentlemen, partners. We all recognize that technology transfer and knowledge sharing are 2 of the most important enablers to ensure local production of health products in our partner countries, and as such are a central driver of health sovereignty. We hear so much rightly about this these days. And that is why, through the Manufacturing and Access to Vaccines, Medicines and Health Technologies in Africa MAV+ initiative, implemented in a Team Europe fashion, we are fully committed to working with key public and private partners to facilitate tech transfer, to strengthen health systems, and reinforce preparedness and response capacity in Africa in full alignment with our Global Gateway strategy. MAV+ has a 360-degree approach, tackling local production from 3 different angles: supply, demand, and enabling environment. Technology transfer is both a cornerstone of the enabling environment, but also a direct driver of the supply ecosystem. And this commitment is translated in concrete activities implemented through our MAV+ initiative. At continental level, for example, we are supporting Africa CDC to conduct a tech transfer needs assessment and develop a handbook for biopharma tech transfer, which will enable manufacturers, regulators, and partners to align efforts and drive Africa's self-sufficiency agenda. And we have a strong alliance with Latin America and the Caribbean too. Our commitment to translational knowledge is also shown through our support for the WHO Medicines Patent Pool mRNA Technology Transfer Program, and I would just like to say a few words about this, if I may. COVID-19 pandemic exposed the global inequalities in access to life-saving health technologies in a brutal fashion. It was a wake-up call, and since then we have learned valuable lessons. And this is why the mRNA technology transfer program is so crucial, because it directly addresses health equity. It facilitates access to advanced technology, such as mRNA, by creating scientific and tech capabilities, together with sharing of intellectual property, empowering low and middle-income countries to produce their own vaccines and therapeutics. And consequently, it reduces the reliance on external resources and contributes to building strategic autonomy for our partner countries, while also contributing to health security. Health security in our connected world can indeed be considered a foremost public good. And this is indeed at the center of our global gateway strategy, to build trusted, resilient partnerships in critical sectors, among which health. We have been supporting this effort since 2022, and since then, important progress has been registered by the program. I would just highlight two examples among many. The important advancement in strengthening the R&D pipeline in support of mRNA-based products, this has been achieved. And also several manufacturers across the globe have received training on tech transfer and mRNA vaccine production at Afrigen Biologics, contributing to the overall local manufacturing agenda. These are just two of the many achievements. Of course, a long road still lies ahead. We all acknowledge the challenges that need to be overcome in the following years, particularly to make sure that the R&D pipeline built on the needs of the continents translates into concrete products available for the regions. And this will require further concerted efforts. This is the next stage in the development of this concept. But let me assure you that Team Europe will remain a reliable partner to advance this agenda. Thank you very much.
This is indeed very good. I think so far we're making very, very good progress with this kind of commitment and the renewed resilience towards this program. I think this is definitely what the mRNA Tech Transfer Program 2.0 should be sounding like. More support and commitment into the future. I think this is very good. So thank you so much, Martin. And I think I like also the fact that you've zeroed in a lot on tech transfer. I think as you rightly draw the example from the pandemic, this was one of the gaps that made it even more difficult, even for other willing participants in the game, to try and make these medicines and technologies available because of the airtight patents that existed. And I think that's why the medicines patents pool is doing such a good job in trying to bridge the facilities that are being built with the right kind of patents negotiations, and then the capacity, all these meet in one. And I think Afrigen has been a very good example of what can happen when all these efforts merge into one point. So thank you so much, Martin, for that. And at this point, I'll turn my attention to Annie-Claire Ampou, who's the Global Health Ambassador, France. Annie-Claire?
Thank you very much. Excellencies, ladies and gentlemen, dear colleagues, it's a pleasure to be here this morning in this wonderful palace for this event organized by WHO and MPP. As you know, France and Team Europe have been strong supporters of the mRNA technology transfer program since the beginning in 2021, and France has dedicated 70 million euros to this program. This program is essential in the current context of funding cuts and strong demand from low and middle income countries to threaten their health sovereignty. Looking back at where we started in the midst COVID-19 crisis, I think that we can collectively be proud of what has been achieved and have to take stock of the progress of the program and look at how we can further leverage our wins during its second phase especially in order to have a sustainable program. As it was said, the results are good, but it is still fragile. The mRNA program is consistent with the French Global Health Strategy to promote local manufacturing and health sovereignty. It is consistent also with the Team Europe initiatives, as already mentioned by Martin Sichel, that France supports actively. Why? More than 95% of the active pharmaceutical ingredients consumed in Africa are imported. More than 70% of all pharmaceuticals consumed in Africa are imported. It's a matter of health sovereignty and equity. This mRNA program is also aligned with the operationalization of the pandemic agreement adopted last May, as it was mentioned by Dr. Nakatani earlier. And you know, France was involved as a co-chair of the INB in this negotiation. There is the Article 10 about sustainable and geographically diversified local production. There is Article 11 about transfer technology. It's a matter of equity. It's good to have a text. Now it must be operationalized. And this program is a good example of this operationalization of this pandemic agreement. But at the same time, we shouldn't forget that when we talk about local manufacturing, technology transfer, there are prerequisites if we want it to be sustainable. First, a market. Market shaping is key, and it is the role of UNITED with other organizations. Second, we need a strong regulatory framework. That's why there is the Article 14 in the pandemic agreement, and that's why France, alongside the European Union through European Medicines Agency, has a partnership with the African Medicines Agency. And the regional level is also key. Third, we need well-trained human resources. The adequate training of human resources is essential for the full appropriation of technologies such as mRNA technology. And the WHO Academy will provide all partners with a platform to connect training materials, including technology transfers. Just to conclude, local manufacturing, technology transfer, it's very complex, you know that. So that's why we need and support this program, which can make a real difference on the ground. For equity, and it must be also coordinated with other programs led by other organizations. And as it was said earlier, multilateral cooperation is more important than ever, especially in the current context, and especially when we talk about public good. Thank you.
Thank you very much, Annie-Claire, for those words. And I'll keep on picking snippets from each of the speakers if I can. I think you bring the issue of market shaping. The regulatory side of the equation also has to be, I think, carefully integrated at some point in this program. And I'm also glad that you mentioned the African Medicines Agency, because I think these are critical pieces that are needed to actually, as you use the word, operationalize these ideas. There's commitment, but that commitment has to bear fruit. And I think if it's going to bear fruit, we need to look at each of the moving pieces that need to be on the board before this can happen. So I'm very happy that you bring in market shaping, you bring in the skills training, you bring in the regulatory side. I think these will create a sustainable platform wherever these sites are going to be located. So thank you so much for those and for France's support to the program. All right, thank you. I think now we're going to go online to Ralph Retter, BMZ, German, who I believe is online. Yes, perfect.
Yes, thanks a lot. On behalf of the German Ministry for Development, I would like to express my sincere thanks to the WHO and to Medicine's Patent Pool for for advancing the mRNA technology transfer program, and also, of course, to Belgium for hosting this excellent conference. Strengthening vaccine and pharmaceutical production in Africa is key for the German global health engagement. Since 2021, we have supported a range of initiatives across the continent as part of MAF Plus, which was has been mentioned before several times. Germany is the biggest contributor to MAF Plus, and we look forward to moving this important initiative forward in our at our high-level steering meeting in South Africa in 2 weeks' time. And also we look forward to paying a visit to the mRNA hub in Cape Town on this occasion. Our collective goal is clear: to build regional vaccine and pharmaceutical manufacturing capacity that is not only technically capable, but also economically sustainable. And the mRNA technology transfer program is a vital pillar of this broader vision. And equitable access to this technology requires not only technology transfer in our perspective, but also local ownership, a viable business model, and long-term market integration. And this is why our partnership with WHO and MPP focuses not only on enabling production, but also on ensuring that production can be sustained economically and institutionally. Through our cooperation and especially through our implementing agency GIZ, and I'm very happy that some of my GIZ colleagues are joining in person your conference. We support especially 3 key areas of this program. First, strengthening partner companies of the program, such as BioVac in South Africa and Biogeneric Pharma in Egypt. Second, providing support for intellectual property monitoring and product mapping. And third, strengthening R&D capacities of the South African hub. Having said that, we will only achieve the sustainability of this initiative if these efforts are part of a coherent continental strategy. And therefore, we strongly support the close alignment between the mRNA technology transfer program and Africa CDC's initiative. And this is also why Germany's engagement includes analytical and dialogue-based activities, such as supporting studies on financially sustainable business models. Coming to the end of my statement, I would like to emphasize that as the program enters its second phase from 2026 onwards, Germany remains committed to accompanying this important journey. And I wish you excellent discussions and a very successful meeting. Thanks a lot.
Technically capable, but also sustainable. And I think a good idea of conversation there is local ownership. I think ultimately these programs cannot continue to be externally funded forever. I think that's a fact we have to accept. At some point, they need to be able to stand on their own. And part of the mechanism to allow that to happen is ensuring that there is enough local buy-in, enough local ownership of these programs. And I'll keep referring to the example of Afrigen, because I think this is one where we have at least seen very good levels of local ownership. The South African government is also involved, very interested. And I think replicating such a model in all the sites will really be translating towards sustainability, which Ralph mentioned in his speech. So thank you so much for that, Ralph. Moving towards the next session, which is words from Rikita Nanketiola, who's the Counselor for Political, Economic, and Public Affairs, Embassy of Canada to Belgium and Luxembourg. Rikita.
Thank you very much, and good morning, esteemed colleagues. Thank you to the Government of Belgium, the Medicines Patent Pool, and the World Health Organization for hosting this important meeting. In particular, I want to convey my deep appreciation to the Belgian government for welcoming us in this beautiful venue. We are here to reflect on the accomplishments of the mRNA technology transfer program to date, and to explore how to build on its progress in preparation for the next phase of the program. MPP is a valued partner and a key contributor to global efforts to operationalize equitable access. Their efforts have helped to strengthen global pandemic preparedness, prevention, and response through partnerships and innovation. It is a pleasure to be here to explore how collaboration is strengthening global innovation ecosystems, supporting regional manufacturing and building capacity across low and middle income countries. The program launched in 2021 at the height of the COVID-19 pandemic. As we continue to operate in an interconnected and globalized world, we cannot forget the lessons we have learned along the way. During the acute phase of the pandemic, unequal access to vaccines, tests, and treatments negatively impacted governments' ability to respond in a timely manner. This impacted the effectiveness of global response with costly outcomes. The mRNA technology transfer program sought to redress these inequalities by bringing manufacturing closer to where vaccines were needed through innovation and collaboration. Such partnerships are critical to ensuring the world is more resilient and better prepared for the next pandemic. Canada remains committed to addressing barriers to equitable access to vaccines and other medical countermeasures. This includes support for regional manufacturing initiatives in low and middle income countries. We recognize the importance of diversifying production to strengthen global health security and pandemic prevention, preparedness, and response. To advance these objectives, Canada is proud to have invested in a growing portfolio of global initiatives to accelerate research development and sustainable vaccine manufacturing capacity. This includes $45 million to the mRNA technology transfer program. It is commendable that the program aims to build enough capacity to produce 60 million doses annually, scalable to 2 billion in a pandemic. Although already through collaboration, the program is achieving notable impact. It is on track to establish 11 good manufacturing practices certified facilities across 10 countries by 2030. The program also contributes to improving country and regional resilience through science, innovation, and partnerships. This will help strengthen global supply chains and reinforce the broader biomanufacturing ecosystem, opening up new opportunities for partnership and innovation. At this juncture, we must continue to build on these accomplishments and focus on our efforts on sustainability and scalability of production. This means supporting research and development consortia and continuing to develop the capacity to advance technology transfer on voluntary and mutually agreed terms. Today's discussions will showcase tangible partnerships, practical progress, and forward-looking opportunities to which many of you are contributing. Thank you for all the ways you are engaging to drive a more secure future for all. Together, we can build on the program's progress and reflect on lessons learned to shape a world that is more resilient and better prepared against future health threats, all while advancing equitable access to vaccines and therapeutics. Thank you for your attention.
Thank you so much, Rikita, and also thank you, the Government of Canada, for the support that Canada has continued to render to this program. I think during the last meeting, we heard how much commitment and energy that the Canadian government was ready and throwing at the program. I think as long as that continues, we shall remain purely indebted for this level of generosity. And also picking from what you've just said, I think an equal access in terms of health threats always limits how countries can respond. And I think if you look at the scale of the problem of the COVID-19 pandemic, there were a lot of issues there which don't perhaps need to go into. But the point you raised there, that limited or unequal access to vaccines or medical countermeasures really does create limitations in terms of how governments can protect their citizens. And it is, I think, the thorough hope of this program to begin to correct some of these, discrepancies in terms of ensuring and equipping governments to effectively respond in total, uniformity with the rest of the world. And hopefully we should be able to end these pandemics quicker than we did during the COVID-19 pandemic. So thank you so much for that. And at this point, I will be turning my attention online. Mboneni Mwefe from South Africa, I believe is online. Perfect, thank you. Over to you.
Good morning and thanks a lot, Program Director. I just want to first express my sincere gratitude to the excellent hospitality of the Belgian government. I am told that you are in a very beautiful venue, which I can see, and I can also feel remotely the level of hospitality. I just really want to reflect back on what happened in 2021 in the heart of COVID, when this program was launched. It was a time when we were hearing phrases so frequently like, you must never waste a good crisis. And at the time, I think for some of us, we didn't actually know what that would look like. And today I'm excited to say that the mRNA technology transfer program actually embodies this whole phrase that we must never waste a good crisis. I think that firstly, to really look back and reflect on what that crisis was, is also to look at the leadership and the vision of the World Health Organization and the Medicines Parent Pool. Because when we started, in the middle of all those challenges, it seemed like all was lost. And I think that even as the discussion started and the ship was being steadied, and I can actually say that that particular ship is steady, but the steadiness of the ship doesn't actually indicate that everything has always been smooth. There has been a lot of storms that this ship went through, and I think through the leadership of the likes of Maripol Teni and also the other members of the steering committees, the hard work that has gone into ensuring that we must never give up even when things are not going well is actually the reason why we're sitting here today. I also need to acknowledge the role that has been played by our fellow funders, because I think this program wouldn't have gone anywhere without your efforts. In fact, this is really just shown, as the Director General Heidi has indicated in the beginning, that global solidarity is a beautiful thing. And we will never have achieved this if the world hasn't come together to say, how do we deal with this challenge, which is actually going to mean that we empower those that may not have the means and the wherewithal to build capacity to be able to respond. And what is crucial about this thing is, it's not just about looking at COVID, it's about how do we look broadly in terms of saying this platform is going to be something that as and when another pandemic hits, there is going to be a certain level of readiness by the countries that have benefited from this. I also want to really thank the commitment by those partners who have been part of this training. One of the key words that has been used here is the issue of ownership. Even as we decided to find resources to support this work, there was really a sense that if we don't own up in this program, then we are not going to be able to reap the rewards that we need to reap. So I therefore want to say it is quite exciting that we've had so many partners who today stand having benefited from this, and they wouldn't have benefited if they were not committed to this concept of ownership. Let me also acknowledge the role that has been played by Africa CDC. I think it is quite important that we appreciate, as one of the speakers have indicated, the aspect of market that as member states in the African continent, we probably don't constitute a big enough market to make these programs viable. But with the leadership of Africa CDC, we look at ourselves as the big Africa market. And we also look at ourselves as a big Africa a platform where we can really look at what are the kind of diseases that are actually a problem to our continent and how do we put our heads together to solve them. So I think that for me, again, it's important to just acknowledge the role and the leadership of Africa CDC. As Maripol has indicated, the whole concept of moving into this program, the phase 2.0, actually means that we have to complete what we have started. We have to really move to a point where now the good work that has started, the momentum that we have currently built doesn't get lost. So we are looking forward again in terms of all the support and the solidarity that we have seen during the phase 1 that is going to continue. So from the South African point of view, really reflecting also on the role and the commitment that we have seen being played, in particular by Professor De Blanche with Afrigen, Dr. Mrena from BioVac, and all other partners. I want to say, yes, we have really laid a good foundation. We must continue to build on it. The foundation is solid. Hence, the walls and the windows and the roof can only be as solid as the foundation that has been laid. So I want to say with those words, thank you very much. We're looking forward to the exciting progress that we are going to build through phase 2. Thank you very much.
Thank you. Thank you very much, Moneni, for those words. I think you speak truth when you say that global solidarity is indeed a good thing, and through this kind of program, we are creating the empowerment that is much needed. And maybe before we get to the last bit for this particular session, I would again like to maybe take a moment to think about what the COVID-19 pandemic looked like. For those of us that remember, which I believe is everyone, if we truly think about for a second what that looked like, I think all of us in this room should be confident in saying never again. Never again. We cannot, as a world of capable leaders, capable resources, stand by and ready ourselves for what we experienced during the pandemic. We should genuinely allow ourselves to do better as a world and everyone involved. And I think this program in many respects really does put us as a world on the right path, a path that really communicates that life is precious regardless of where it is. And I think this program does embody that spirit in many, many ways. And if I may, I also wish maybe to just put Dr. Masoka Fala on the spot a little bit, because during the pandemic, him and I were involved in a campaign which was aimed at trying to get vaccines to Africa, a very, very rigorous campaign. The first time I met him in our work. And if now I ask him how or whether it was successful, I don't know what his answer would be. But really, there was a lot of work that needed to be done and a lot of gaps that existed then. And that's why I think this program is unique in many, many ways, because it goes beyond the politics, it goes beyond the rhetoric, it goes beyond the commitments. This is a practical step in the right direction for a globe, for a world that does care about human life. So to all the program partners, to all the funders, I, as a person from Africa, we should take this opportunity to say thank you for the amazing work and commitment you've shown so far to this program. And I implore you, please continue with these very, very useful efforts. Thank you so much. At this point, maybe we quickly transition to program achievement Vision and Sustainability, and I wish to invite Charles Gore, who's the Executive Director, Medicines Patents Pool. Tell us about the mRNA Technology Transfer Phase 2.0.
Thank you very much indeed, Zach, and thank you very much to the Government of Belgium for hosting us here. It's a tremendous venue for this. So I'm not going to talk too much about the first phase, except just to mention a little bit, next slide please, in terms of the funding, since you're all here and almost all, and we are very grateful. That's rather a busy slide, but in fact, each point is where one of you as funders came in and gave us more money and so on. And I should just point out that actually this started with France, and it came about because when it became apparent that vaccine manufacturing, particularly in Africa, was sorely lacking, the government of France proposed another pillar in the ACT Accelerator on manufacturing. And in fact, that then morphed into the mRNA program sitting under COVAX. So once again, thank you all very much. And I'd just like to pick up on what Zach said about really keeping in the forefront of our minds what it was like during the pandemic, because it is extremely easy to forget and therefore to lose urgency and think, oh yes, well, there are more important priorities right now. And of course, there are a lot of priorities right now. But if we don't want to go through that again, and if we can really keep it at the forefront of our minds, then I think that's a good impetus for us to move to a second phase of this. Next slide, please. So, as you know, really the first phase was about the platform development, the training, and the technology transfer. And obviously not all of our partners are on exactly the same level, and so this is not completely finished yet. But at the same time, we need to move to a second phase, and that is really putting sustainability at the top of what we're trying to achieve. So it'll be focused on the product pipeline, business plans, because these have to be sustainable from a business point of view, making sure that everyone is up to GMP grade manufacturing, and that at the end of the day, we can have impact in the real world. And as Ambassador Amprou said, so clearly this featured quite a lot, although not particularly by name, but it was definitely talked about in the pandemic agreement, particularly under voluntary licensing and tech transfer, and will continue to be a source of discussion in the ongoing intergovernmental working group that's discussing the pathogen access and benefit sharing agreement right now. Next slide, please. So in 2020, we had no mRNA capability in LMICs. We now have two who have capacity in a GMP certified environment. By the end of 26, we'll have 6, and by the end of 2030, we will have 10. That does not mean that the others will be neglected. We will continue, as I said, even those who started a bit behind, to make sure that everyone has at least the ability to do GMP mRNA manufacturing. Next slide, please. So where are we in terms of a pandemic response? By the end of 2026, we should be able to produce 140 million doses yearly. That is not going to be enough for a pandemic. However, with new technologies like dose sparing, through, for example, self-amplifying RNA, we should be able to get close to 2 billion doses. That suddenly becomes very important for LMICs in terms of a pandemic response. However, the key part about being in that position is making sure that the staff are there, continue to be trained on the latest technology, the machines are serviced, they're warm, the electricity, the lights, everything are functioning. And for that, it is imperative that our facilities produce products now, mRNA products. And of course, mRNA is not just about vaccines, it's about therapeutics as well. But the question is, what products actually we're going to be looking at? Next slide, please. So we've built, with input from most of you, the second phase on 3 pillars in order to ensure this sustainable, commercially viable operation of the program. So these are partnerships and research and development, capacity strengthening, and program integration. Next slide, please. And I'll go into these in a little bit more detail, but I'm actually going to leave this to Petro to go into it in a lot more detail, because I'm trying to give here just a top-line view of this. So clearly we need products. These can be produced through R&D, and there are these consortia being assembled, but could also be done through in-licensing. Then making sure that the mRNA platform is fully implemented, that there is scale up, that there's GMP readiness, and then finally that the program is integrated into a whole ecosystem. It simply cannot stand alone. We need to make sure that there are supply chains, that the health systems are there, that, in my view, critically, the governments are behind this and are prepared to buy the products at the end of the day. And one of the things that we asked right at the beginning was, if you want to be a recipient of this technology, you must bring your government support with you. And this is a critical part of the entire regional local manufacturing agenda, that those countries who want health security, they want access, they want industrialization, need to play their part by what ultimately amounts to increased expenditure on health. And of course, in order to make all this happen, there are a lot of enablers like in licensing, as I said, collaborative platforms for co-development. You need a lot of legal and policy support. Make sure that there's an IP framework in place for sharing, that, as has been mentioned, regulatory strengthening is absolutely critical, and the convergence to shorten the regulatory pathway as much as possible. And as I said, the market access and the demand are critical. Next slide, please. So the program has moved from concentrating, as you know, on COVID-19 with Afrigen Biovac, the South African MRC, and also its consortia of universities and research institutes in South Africa, as well as the manufacturing partners, and thank you all for being here, to looking more at R&D and setting up these consortia to develop projects in a number of different disease areas, but not just disease areas, also lipids and enzymes to try and improve the process, cut the costs, improve thermostability. And that has brought in other players, universities, research organizations, and so on, and now moving to a strengthening in that field and bringing in some of the leaders in mRNA, like the University of Pennsylvania, for which 2 of its researchers got the Nobel Prize the year before last, Children's Hospital of Philadelphia, who work very closely with the University of Pennsylvania. And again, the same, but a much bigger group of people actively looking at R&D, but at the same time looking at what we can in-license. And we've been kindly funded by Germany to do a whole scoping of all the products, all the mRNA products in phase 1, 2, or 3 clinical development, with a view to going out and in-licensing them, because research and development is never as quick as one hopes it will be. And so to fill some of those gaps, but also to do it in a complementary fashion, to look at in-licensing as well. Next slide, please. So, as I said, we have these consortium, we're looking at in licensing, but on the consortia side, what we want to do in phase 2 is to move towards a self-sustaining ecosystem with funding for preclinical trials up to phase 1 at around 3 to 5 million euros a project, to de-risk further investment by the private sector. And it has become absolutely imperative in the current environment that ODA money is a catalyst to bring in private funding. We cannot rely on ODAs to fund everything. That's just no longer possible. And so that's the phase 2, 3 up to approval. That sum would come from elsewhere. And then the idea is that this would create products that have a good business case and that provide revenues for sustainability for our partners. And in order to do that, we will need to help them with business plans, putting together events to actually discuss this, helping with co-development agreements, intellectual property and licensing, having expert input all the time, particularly on which are the best products. And as I said before, the criticality of government engagement.
At this point, I will maybe turn the attention to Pedro Teblanche, who's the CEO for Afrigen Biologics and Vaccines. Tell us about the next steps in increasing the scale and ensuring sustainability. Pedro?
Thank you very much. Good morning to our funders, our partners, and our friends. It's a privilege to be invited to share some of the achievements and what this program has enabled in this beautiful place that's so timeless. Can I have the first slide, please? You must be on the PowerPoint. Thank you, Julie's. Okay. Yes, I'll start with this one. This is a slide that's very, very, very dear to me personally, and I've seen it evolve over the last 4 years since the start of this program. And this shows the partnerships to support the organizations, individuals that worked with us in this program. And I remember in the early days, we said this is going to take a village. When I look at this slide with recognitions to so many people in this room, it's actually a universe. So from Afrigen and the team there, I give a shout out to the team online. A thank you for what this program has achieved and done for us. And let me share with you some of the achievements and what this program has enabled. Julie's, the next slide, please. And I'm going to do that building on the presentation that Charles just did. So I'm going to take the 3 key pillars of mRNA 2.0 and use as examples of how mRNA 1.0 has demonstrated how important it is for this program to continue and how we can continue to build. Next slide, please. Capacity strengthening. Next slide. So this is a picture for Afrigen. If we look at the multiplier for the partners around this room and for SAMRC and others, these numbers are much, much bigger. This program has created 168 high-quality jobs in South Africa, in Afrigen. It has created translational capabilities from R&D to manufacturing and development. This is a team of people that is very female-dominated. It's not mine. Don't blame me for it. It's a wonderful privilege. With 63% of our staff are women, and employment equity more than 76%. This is a diverse and wonderful team of people, but with the average age of 34. It's a young team. It's a highly qualified team, but it's a team that's learned and has fast-track experience phenomenally over the last 3 years. And this is just one picture. Each one of the partners around this table can show a similar picture of what this program has enabled. The next slide, please. Charles has showed the slide of the ultimate impact, taking us to 2025 and up to 2030, and how we're creating pandemic preparedness and sustainability. But there's a journey to get there. And on the left hand of the slide is the long, winding route of developing a platform validate the platform with a new vaccine candidate, and creating facilities that can actually produce GMP lots of a vaccine, an mRNA vaccine, and to translate the knowledge and the R&D into a technology transfer package. And on the slide in the long road on the left, which was an exciting journey, there's 2 red circles that I want to point out. On the left, in the early days in December 2021, the role of University of Witwatersrand in working with us to create the first laboratory scale concept of a vaccine. And the next slide is BioVac, also present in this room, who's worked with us with some of the analytical development. To appreciate that what was developed in the mRNA platform at Afrigen and shared with partners was greenfields. None of the people in Afrigen, the 168 people in December 2021, has ever worked on mRNA. I'd like to demonstrate as we move forward where we are today with the support and the partnerships we have. So for us translating from R&D to produce preclinical material and clinical material to advanced development for ultimately, as Charles said, to have products in the market is a journey. The next slide, please. And let me talk about technology transfer part. Our partners sitting around the table, just to give you some visuals and some experience of what this really entails. This is not only about paper. This is not only about processes, but it traveled on 2 legs. So we would welcome our partners at Afrigen with their flags flying in the Cape Town wind. No better welcome. And we celebrate after 3 weeks of intense technology development, technology transfer, co-development, produce the drug substance, learn the analytics, apply the analytics, produce the drug product. And here at the bottom of the slide, we can see the Snow Gym team celebrating the drug product, mRNA drug product that they've just developed. And this on the side is a plate. It's a traditional Cape Malay dish, which is very sweet. And we reward the teams when they deliver the drug product in our laboratories and working with us, with my teams, with the Afrigen teams, we reward them with Cook Sisters. So this is about relationships. It's about building partners, bilaterally and multilaterally, for a sustainable future. Next slide, please. And part of what this program has enabled, and the South African Medical Research Council and our other partners are here today also, is to create an ecosystem in South Africa, important for a continent, as we've heard earlier, that imports most of the medical products that we need. And this partnership is the SAMRC consortium that is an end-to-end academic, public-private partnership that advances mRNA technology through development for the sake of the mRNA tech transfer program. A core component on how this program over the last 4 years has created an ecosystem for innovation. Next slide, please. Let me move and talk about RNA product development. Imagine a global effort to scale mRNA products for impact for epidemic and pandemic preparedness and response, just in case we need it. And what this slide shows that there's a deep understanding developed in this program around what mRNA is. What are the different RNAs? Where are the benefits? Where are the risks? What are the products in development? Where are the gaps? Where are the needs? Can we contribute as a program with partners, all already involved in R&D activities, to develop new products that addresses the burden of disease in low middle income countries and address unmet needs through innovation and partnerships? We understand the markets, we know the uncertainty, we know that burden of disease doesn't necessarily translate into demand, but we intend to work so that that equation actually does translate. Next slide, please. And engraved and incorporated in this program was an ecosystem lens. And this slide shows examples of how this program has expanded and looked at an ecosystem. On the top is a slide with a partnership and collaboration with KU Leuven University here in Belgium that is working with Afrigen and BioVac to model the entire ecosystem and the development of the technology platform to ensure that we have sustainability and competitiveness. And this program has also, since its inception with a design for sustainability, embrace innovation and new technologies. On the right-hand side, our partnerships in AI, adopting AI technologies for antigen design, for fast-track antigen design, and to improve secondary manufacturing capabilities and technologies to ensure that what we develop is affordable and accessible, meets safety and quality standards. And again, our partnership here, the Belgium group Quantum. And how do we fast-track the development of pDNA? Working with CEPI and supported by CEPI in speed. How can we ensure that we have speed of development? All of these partnerships and embracing innovation would have been impossible without the support of this mRNA tech transfer program. Next slide, please. And regulatory, the importance of strengthening a regulatory system capacity, particularly in Africa. And I'm sorry, one step back. Sustainability into the product development. It is critical that we build a product pipeline. And in the next 3 days, this program meetings will continue to unpack different products, the pipeline, the progress. And here, this is the current product pipeline of the SAMRC group, including Afrigen, supported by people around this table and organizations around this table. What does this do? This develops pipeline for sustainability, but it also builds capacity and capabilities. It demonstrates that the mRNA technology platform can be pathogen agnostic. That is a key part of sustainability. The next slide, please. Program integration. First one example that I'd like to use is going back to regulatory, the importance of regulatory strengthening. And this is a hot off the press announcement. This program has enabled Afrigen through the last 3 years that we built a facility, we completed end-to-end processes, and we completed a GMP inspection with SAMRC according to PICS and WHO guidelines. We have now been designated a pilot site for regulatory training to bring inspectors from the African Medicine Agency through the NEPAD program into Afrigen's facilities to train inspectors from the African continent to inspect end-to-end facilities and to understand the value and the complexities of mRNA, proudly enabled by the mRNA tech transfer program. This is not just about research and technology. This is about also a total regulatory framework. Next slide, please. And we have deep understanding of what will make mRNA sustainable. We've worked with partners and people in this room. I see some of our MSAC members here to understand how important is affordability, how important is thermostability, how important is pipeline development. And this program has enabled us to build partners on 7 continents of the globe, moving mRNA forward to be sustainable as a technology platform. Next slide. And a complex multi-party partnership with public entities, public-private entities, academic entities requires at the center coordination and management. And I want to congratulate and salute the MPP and the WHO for herding cats, for bringing a complex network together. And as we're moving forward, that role of coordination, synchronization, and management with a common goal will be increasingly important. The next slide, please. And we've heard on the video call earlier how our partners, the partners in this program, has taken the initiative to start developing at R&D level new products, prioritizing products of the burden of disease in their regions. This is a beautiful map of product pipeline and product portfolios for this program. As we move forward, the call is that we continue to coordinate this, to sustain this, and build the product portfolio that the partners has already taken the initiative to build. Next slide, please. And this is my last slide. We have built the fundamentals of an unprecedented pandemic preparedness and response network in LMICs. This was enabled by partners on the 4 continents, but in fact on 7 continents if you look at the collaborations in this program. We are well geared for the next phase is to take products right through to the clinic. Because what drives this program is the sustainability and ultimately to have products developed in the program into the clinics and making a difference to the public health and unmet needs. We have created a model for global partnerships, public, private, academic, and we need to foster this to continue. To restart this program and to rebuild it and to demonstrate the scale will be almost impossible. Preserve and strengthen a network and partnerships while expand our impact and ensure that we have sustainability. Thank you for your support.
Thank you so much, Dr. Blanche, for those words. And I think for majority of people who've been part of this program from the very early days, I think it has grown, it has moved, and yet we still have work to do. I think phase 2.0 is going to allow just that to happen. And specifically, the point you mentioned on these platforms being pathogen agnostic, I think is very key because it ensures that there is flexibility to adapt the platforms to whatever pathogen we may be dealing with in the next pandemic. And I think that is also one of the unique flexibilities of the mRNA platforms as a technology. So I think this program really does have great potential, and thank you for your leadership and for being at the center of this, this work. For the first part of the afternoon program, which is a deep dive into the mRNA Technology Transfer Program 2.0, session 1 is going to be moderated by Martin. I think he's ready and geared. Martin, over to you.
Okay, thank you. So we heard this morning that we basically taught people how to make mRNA. And they all said, that's great, thank you very much. Now that we know how to make mRNA, what can we make that we can actually sell to pay for the staff, the light, the water, the electricity, etc.? And so this is really one of the key components now of phase 2 of looking at the portfolio. But most of the partners in this program are manufacturers. They are not researchers. So this therefore requires us to have very close collaboration with researchers. And we are delighted that we have very close collaboration with the Children's Hospital of Pennsylvania. So I'm now going to ask Mohamed Gabriel Alame, who's been doing some amazing research on the applications of mRNA, to give us a taste of what is coming down the mRNA portfolio and what the possibility would be of our partners being able to acquire this at early stage or mid stage or late stage. The most important thing being that sooner or later, preferably sooner, our partners are able to manufacture products that people will buy. Mohamed Gabriel, please, over to you.
Thank you so much, Martin, and thank you for having me for the third time now. So today, actually, the question, or before I start, I just want to give a disclosure of, I'm cited on certain patent regarding the use of LNPs. So today, basically, the most important question for me and for everyone here in the room is what's next for the mRNA LNP platform beyond the vaccine? So before I start diving into what we have been doing and how we are seeing the field evolving, I would like just to give you a brief introduction on the LNP or the mRNA LNP platform and focus mostly on the LNP, which is the other important coin in that platform, right? So usually a LNP or a lipid nanoparticle is a 4-component particle that contains a PEG lipid, an ionizable lipid, a helper lipid, and cholesterol. So usually every and each of these components play a very important role in the stability, the potency, and the toxicity of these molecules. The mRNA LNP platform is a very flexible and versatile platform with a tremendous development space. So I know that there is a lot of concerns on the IP perspective because there is a lot of IP held, especially on the ionizable lipid design and the formulation, but there is still a very big space of maneuver. The LNP platform, as I said, it's main 4 components. The ionizable lipid plays a very important role in the potency, immunogenicity, reactogenicity, and tropism, as well as the product stability. So the chemical head groups, for example, of these ionizable lipid play a very important role in the stability. So working on these will enable us to have more stable products. The PEG lipid also, which is one component that ensure the LNP to be stable colloidally in the vial, plays a very important role also in the immunogenicity, reactogenicity, and on product stability, and so forth, right? So people have been working on developing novel ionizable lipid, and we'll discuss a bit how we are tackling this problem, and then also changing the different components. So every time you change a component, you have a different formulation, and therefore you can actually break the IP barriers that people have set up at the beginning of the pandemic. And then obviously it's also very versatile because you can modify the surface of these particles with either antibodies, proteins, or even radioactive molecules, and then use these as dual component systems. So usually mRNA LNP are formed through a rapid mixing of an organic solvent phase that contains the 4 components and an aqueous phase that contains the mRNA. So the way we are mixing them, and depending on the geometry here in the middle, the particles will form, and these particles will be treated or buffer exchange in order to bring the pH from around 6.5 to 7.4 and to remove impurities such as ethanol. So as you can see in the slide here, formulation parameters, manufacturing process, or process parameters such as the speed at which you are mixing, the geometry, the whole time, play a very important role in the critical quality attributes or critical parameters, such as the size, the surface charge, and the encapsulation efficiency. So these are very important parameters. Usually people, when we look at these particles under the microscope, we'll see that they are around 80 to 100 nanometer, very spherical particles. So I do like to emphasize on these points, especially on the process parameters, because I like to show this work that one of the PhD students in my lab has been working on, where she changes the different parameters in the manufacturing process. In this case is the ionic strength of the buffer, where the mRNA is, and the concentration of the mRNA and the lipids. And what we can see, for example, that just by changing these 2 parameters, you can find an optimum where you have 4 to 10 times more expression with the same particle compared to the current manufacturing parameters. So today, when we go to a manufacturer, usually they take the mRNA, they dilute it at 0.2 to 0.4 milligram per ml, and they'll mix it at the same ratio with lipids. Right? And that would be in a certain salt solution. So if you change the salt solution and then just increase the mRNA to 2 milligram per ml and take the lipids proportionally and then mix them, they'll give you the same particles with 4 to 10 times more potency. And as you can see here, this potency is not reflected only on the in vitro side, but also on the in vivo side when we do intramuscular administration, where you can see, for example, this increase in luminescence or protein expression, as you can see here with the red dots. So I'll go back to the same process of manufacturing, and I want to emphasize that usually all these critical quality parameters are measured using population-based analysis, right? Like how we determine the size of these particles, their polydispersity, and the charge is using techniques that will measure the whole population. So it doesn't give you an idea of what is happening inside of your product, and it doesn't give you any idea of how the process is influencing these. So a postdoc in my lab, her name is Tong Wu, she wanted to tackle this question more closely, and then she started looking, obviously, at cryothem imaging. And what we can see in these formulations that people produce, whether it's GMP or not, that they are very heterogeneous. They do have also blebbing, different type of blebs, different number of blebs per particle, and then the heterogeneity in size is also very, very, very marked. So what we did, we asked our question, is this heterogeneity changing anything regarding to the potency? So we developed actually a pipeline of characterization that allows us to analyze the particle at a single particle level and also to isolate them or separate them based on certain characteristics. And what we've seen, for example, if we are taking some particles and making them with, here in this case, with fireflies luciferase, which is an enzyme, and making these particles at different NP ratio from top to bottom, what we can see is that when we inject them IV, we can collect a certain level of luminescence or protein expression. And if we fractionate these LMPs and then specifically take one of the subpopulations, and then re-inject it at the same dose as the fresh ones, we will see that we increase actually the potency of these particles. So it's basically a subpopulation in that particle or in that sample that actually has a better potency compared to the whole population by itself. And when we measure this, we can see 2 to 3 times approximately an increase in potency. And then we've tested this not only with Luke, but also with antibodies that are encoded by mRNA. And then we see approximately 1-fold of increase. So when we look more specifically into these subpopulations, and then we use very advanced techniques such as SACS, what we find is that there is a difference in packing actually of the layers in these subpopulation that gives that improved in potency. So if you look at this fresh, for example, or this NP6, you will see that it has both a lamellar phase and the hexagonal phase, whereas the fractionated ones, or the ones that are high potency, they are usually very hexagonal phase. And when we look at the Q value here, which is a representation of how packed the lipid bilayer and the mRNA are, we can see that there is a shift actually in the packing or that interaction between the bilayer and the RNA. So that's basically on the process level, right? I just wanted to say that there is a lot of effort that still needs to be done in order to improve manufacturing processes and get better quality. So one of the things that we have been doing in the lab is to understand these parameters and how they affect potency, and then changing how we manufacture these LMPs to get a better quality particles and more homogeneous. But another thing that we do in the lab is basically the design of the novel ionizable lipid to enable mRNA vaccine and therapeutics. So our approach is slightly different from usually a lot of people who have been using combinatorial chemistry. But before I dive a bit into our approach, I just want to remind everyone about the structure of an ionizable lipid. So it's mainly a head group, a linker, and a tail. And if we look at the head groups, linker, and tails, there are plenty of different chemical compounds that we can use, hundreds and hundreds, and that makes you a combination of a space that's basically unimaginable of how big it is. But obviously, if you link these head groups, linkers, and tails, you do not necessarily always get a potent molecule, right? So we know from Peter Cullis' group back in the days in around 2010 that the pKa, which is the surface charge or the charge of the particle, is very important, with an apparent pKa around 6.5 being critical for at least IV administration. And then another also hypothesis that Peter Cullis and his group has shown is that the more conical shape of these molecules, the better they are actually in terms of potency. So what we have been doing is developing a model in order to predict the pKa of the pKa of the lipid can be computed actually with general thermodynamic models. But then what people don't know, or what we as a field don't know, how does this lipid that has a specific pKa, when formulated into an LMP, will change its pKa? So that's what we call the apparent pKa. So what we have been doing actually is taking these structures and then computing their pKa, theoretical pKa, measuring actual pKa by NMR of these single molecules, and then looking at how it translates into the apparent pKa of the LNP by TNS, and then doing a thermodynamic model that we are refining now. And that thermodynamic model will allow us basically, or is allowing us to, when we design in silico molecules, to predict what would be these molecules pKa in a lipid bilayer, and then allowing us to eliminate them before even synthesizing them. So that approach, we're using it in the rational design of these molecules, where we change head groups, tails, linker length, and as well degradability. So we have two chemists in my lab, one organic chemist called Amira Mbarak and Tay Anderson, who's also a sugar chemist. And we started, which by the way, Tay Anderson used to work at Afrogen, and I stole her from them. So Tay and Amira have designed some ionizable lipid. It's been a year we're working on that. And what we are showing you here, just with IM administration, that we are able actually to get very good and high potency lipids that are comparable to SM102 or to steadfast, for example, ionizable lipid. And these ionizable lipids are either at par or higher even of SM102. That's for IM administration. And when we look at the IV, for example, here I'm showing you that we have 20 different ionizable lipid or 20 different LMPs, and then we can see that 50% of our ionizable lipid in our approach are higher than SM102, that's the dotted line, up to 4 times more. And then when we add to them formulation development or formulation optimization, then we can up their potency up to 10 times. And this is IV administration in mice, obviously. We have tested these formulation in non-human primate, and they are significantly higher as well as SM102. So why am I showing this data? I'm showing this data because I want to say that ionizable lipids are still, I know the IP landscape is very tight, but there's still a lot to innovate in, and a lot of ionizable lipid that we can claim and we can share with basically low and middle income countries. And one of the approach that I was discussing with Martin is in my lab, what we are doing and at the Children's Hospital is using these ionizable lipid for obviously therapeutic purposes, but we do want also some of these ionizable lipid to be shared actually, and they will be non-IPable basically. That's what we're doing as a model to help and to contribute to this effort. So what is next for the mRNA LNP platform beyond vaccines? One of the things that we have been doing in the lab, and I think this is something that is going to pick up more and more, is to use mRNA encoding antibodies. So in this example, there is a postdoc in the lab who's using or encoding antibodies against C. difficile toxins, toxin A and toxin B, on mRNA. And then obviously we can test different formats of these and different antibodies that recognize different epitopes. But the idea here is to have these mRNA encapsulated into LNPs, injected into mice, and then see how much they are expressed and how much they are actually protective. In the first experiment, we're testing actually both formats, IgG and IgA formats, because we want to induce some mucosal secretion of these antibodies. As you can see, here is the IgG format, here is the IgA format, and then we optimized initially in vivo the ratio of heavy chains to light chain, and we can see that the 1-to-1 ratio actually gives us the highest expression in blood. And then when we look at those responses, we actually achieve doses that are therapeutic. We have now did most of our studies, we look at survival, they are protective, and then we are moving into doing combination of different antibodies that recognize also the spore protein in order to wash it off. The way we see this evolving is basically, instead of having an antibody in the fridge at the hospital when someone comes with C. difficile infection and getting injected with that, we can have a product that can be at the bench, or sorry, at the bedside, and that can be injected, and it gives either equal or higher therapeutic effects. So that's one thing, and then you can mix them together to have a multiple different antibodies against the toxins or against the spores. And then we're also doing that for RSV as well, to replace the recombinant protein. The other big, in our opinion, the other big field is in vivo CAR-Ts. So here the concept is, as you probably know, CAR-Ts are very effective for cancer therapies and even now autoimmune diseases. What usually people do in the ex vivo CAR-T cell generation, they would take blood, they would isolate T cell, they would transfect with or transform with virus vectors to generate the CAR-T, expand the CAR-Ts inside of specialized equipment that are very expensive, and then re-inject them into the patient. And this whole process takes around 2 to 4 weeks and costs, at least in the United States, $500,000. That's the minimum. So we have been having at the Children's Hospital of Philadelphia a lot of people coming to us to manufacture actually, or change a bit the ex vivo CAR-T process by using targeted LNPs or LNPs, because that, one, reduces the cost and the complexity of making the viral vectors, and two, it basically reduces significantly as well the cost. So this is a very viable option, and I think there is a lot of people that will continue using ex vivo CAR-T, but they are shifting from viruses to LNPs. And I think here there is a very important market for the LNP or the mRNA LNP platform as well. But I think most significantly, the past 6 months, there has been a couple of big announcements in the biopharma or the big pharmas where there is an acquisition of a couple of companies like Capsan, for example, for $2.1 billion. And this is based on making in vivo CAR-Ts inside of the body. And the idea here is to take targeted particles, inject them or infuse them into a human, and then they would travel to spleens and blood, and in the blood, they would transfect cells, make CAR-Ts, and those CAR-Ts will come back and attack either a tumor or whatever the disease is. So we have been also working on this, and here I'm just giving an example where we have an empty LNP that has a CD5 antibody that was conjugated on the surface versus a LNP that has an mRNA that in this case also encodes an enzyme that will allow us to track actually the LNPs or the expression of the protein by PET scan. I'll get back to one of the very important parameters here, which is the linker chemistry. Later on, I'll show you how important it is. But as you can see in this, hopefully this video, it's not going to work. Anyway, so what you can see in these animals, for example, that the empty LNP does not show any signal in the liver, and the CD5 targeted LNP as well, because these are empty LNPs, so they're not expressing anything. And whenever we have this reporter gene being expressed, you can see that the LNPs are actually in the liver where they are supposed to be. But when we target them with CD5, we can see that these LNPs accumulate actually in the spleen. And if we do a PET scanning, we can see when we compare these two images, we can see that the liver is lit. And then when it's targeted, most of the dose is actually in the spleen. And what we are now able to do is to track actually T cells going out from the spleen and then attacking the tumor or accumulating into the tumor. When we take these and, for example, the spleen, and we look by flow cytometry at the percentages of cells that were actually transfected, we can see that with this approach, we are actually able to hit around 50% of all CD3 positive, which is all T cells, and around 45% of CD4 and CD8 as well. So the question is, can we apply this as well in different cell types? And the answer is yes. We have been doing a lot of studies to edit HSCs, or hematopoietic stem cells, and that's basically for sickle cell diseases. And what I want to show you here, what's very important is when we compare chemistries or linkers, the linker play a very important role actually in the number or the efficiency of transfection of these HSCs. And these are very, very tiny amount of cells that are in the bone marrow. So it's very difficult usually to target them. So we can reach up to 90% of these long-term memory HSCs. One other point I would like to actually stress on is postnatal gene editing for rare diseases. This is something in the US at least is picking up tremendously now, and in Canada. And I think it will be a trend where we will have this personalized medicine being adopted with this technology, with the mRNA LNP technologies. So I'll tell you the story of a baby. I'm not sure if you were aware of that, but we treated the first baby by base editing. This is baby KJ, so it's the first personalized CRISPR therapy. And my lab was actually involved in the design of the mRNA, the optimization, and the preclinical formulation, as well as the process support. So just as a quick background, these ABEs, or the editors, are basically a Cas or CRISPR enzyme that has a link to it, an enzyme, which is a deaminase. And you encode that protein linked to that enzyme on an mRNA, and then you deliver with it a guide RNA. And those two components, actually, you can encapsulate them, and that enzyme can either, if it's a CBE, a cytosine base editor, or an adenine base editor, complete a deamination at a very specific site, actually, in the genome. And then it will change basically the cytosine to uridine or the adenine to inosine, and then DNA replication will come and correct specifically that point mutation to a thymine or a guanine. So you can correct actually point mutations very safely. And these days, these editors are very, very specific, are becoming more and more specific actually. So before treating baby KJ, we were like working on from a concept of a research concept. So we were trying to treat or demonstrate our proof of concept with PKU, which is actually a disease where the enzyme phenylalanine hydroxylase is mutated. So it doesn't change phenylalanine into tyrosine. And what happens is that we showed that a single injection with mRNA LNPs for the editor is able to actually correct the phenylalanine levels in the blood after 2 days, as exemplified here in the orange line. The counterparts are actually in the green, so they are not treated, and then they have these very high levels. And what we see in the brain, phenylalanine, we have a reduction up to normal after a couple of days, and then also the behavior of these mice becomes very normal. So during this time, we were thinking about how can we actually make models that will accelerate the development of such drugs. And one way that we started is to put multiple variants on one sequence and insert them into mice and have them ready actually for any type of mutation for further clinical development, as you can see in this process. And then one day, literally one day, Rebecca and Nicholas from CHOP gets a baby. On day 2 of life, baby KJ was very lethargic. They looked at his blood chemistry, and he had very high ammonia levels. So he was diagnosed with urea cycle disorder. And then they performed some genetic testing at CHOP. In 3 days, they were able to determine that he has this CPS1 deficiency, which is a mutation in one of the cycles, urea cycle disorder. And then he needed a liver transplant. So they hooked him on forgot the name now. Yeah, dialysis. Thank you so much. So blood dialysis. And his parent came to Rebecca, and they asked her, can we please use a drug that you can make, basically an experimental drug. So the time I'm showing here, the timeline, we identified the mutation within days. And then the first thing we did is we did the cell line where it had these mutation, and that was Sarah Gardinet in Kiran Musunuru's lab. And then that specific cell line was created in the first month. We tested multiple guides that were generated with a synthesizer on a small scale. And then we identified one of the editors that has the highest editing and the lowest off-target effect. Once the editor was identified, we were obviously manufacturing it GMP at the same time, and then we were making a mouse model, and that mouse model was generated with the same way that has all these variants in it, and then we formulated these mRNA and the guide, and then we showed that we have, in this case, a dose-dependent increase in the corrective editing in these mice. And then obviously we were talking with the FDA at the same time, so everything was going in parallel. We formulated for the non-human primate toxicology study, where we showed that up to 1.5 milligram per kilogram, there was no toxicity or obvious toxicities. And then that study was completed within the next 6 months. And then we tested in a human cell line that had this mutation, and we showed that we had around 50 to 60% editing. And that was enough for the FDA to grant actually a IND approval. And then baby KJ was basically left or graduated from the hospital at 300 days. But what did this actually accomplish? One is today the FDA is willing and accepted actually that we build these N=1 or N=2 a few trials, and then building this under umbrella type of clinical trial, where you can aggregate certain diseases together and then make a product out of that. So this is basically what we have been doing. And then now at CHOP, the 5 of us with Lindsay and Bev, we are building that whole from end-to-end basically platform where genetic diagnosis and making the GMP product to the IND and to the trial is within 4 months, actually. And everything is kind of type of automated. That's what we're trying to do. So I have few words. Baby KJ was a nice story, but it took hundreds of people working together. Literally hundreds of people working together, from companies to regulatory people, from the people at the hospital. It was basically crazy. And the idea here is that in order to achieve these timelines and in order to achieve this type of performance, we, within this room, have to work all together, right? So that's basically one of the things that I actually learned, is that it really needs collaboration, a lot of collaboration. And the other thing I want to also convey to this message is that whether at the Children's Hospital or my colleague at McGill University, and also I was talking with Equitas, which is one of the companies that produces the lipid, and in my opinion, they were a bit, at the beginning of the pandemic, it was difficult basically to obtain their lipids. But I was talking to them lately because they are in part of this effort N=1, and I mentioned what we're trying to do here. And they are all interested in helping and collaborating with people within this program. So whether it's at CHOP or at McGill, we're happy to help. And if you need any introduction also with other people or any collaboration with Equitas, we're happy to introduce you. Last, I just want to thank the people in my lab. They work very hard, 7 days a week, mostly. And they have fun as well. And obviously, my collaborator and funding supports. Thank you so much.
Thank you, Mohammed. And I will just also point out that Mohammed played a key role also supporting Afrigen in the early days of Afrigen, of really transferring some of his know-how that's in his mind and in his fingers to Afrigen, helping them get off the ground. So some of you that have not been following the mRNA space in this level of detail that others of us have been doing, I'd just like to kind of summarize one key lesson from what Mohammed has given us. When we began mRNA in 2021, mRNA was in its absolute infancy. This was a baby, like the baby you saw a picture of there. There was really 1 or 2 lipids that were available. Now I think I would say there's 1,000, 2,000 that work. There was one way of making mRNA. Now there's 20, 30 ways of making mRNA. There's at least 4 or 5 different types of mRNA that are out there. So I think we have gone from the baby now to the adolescent. Now you all know what adolescents are like, okay? So where will we be in 5 years? In 5 years, hopefully, we will start hitting adulthood. So the question is, how do we get some of these concepts that have been presented by Mohammed, and we'll be hearing also from Drew Weissman, how do we get these concepts from the brilliant idea that's being transferred in very complex laboratory situations, hospital situations in the US, how do we get these to work for our partners so that these become commercial? I want to point out, first time Mohammed presented about Clostridium difficile, I said, yeah, but that's not a problem of LMICs. And then I actually learned it is a problem of LMICs. We use more antibiotics in the LMICs than we do in the high-income countries. And Clostridium difficile, that is what happens when you take too many antibiotics. CAR T cells, well, is that really going to be applicable? Well, actually, personally, I've got friends right now in South Africa. It's not a poor country. And they say, Martin, can you help us get access to chemotherapy? Because we've called our medical insurance, and the medical insurance doesn't want to cover this new chemotherapy that's available in the West. At the price that this is going to be in the West, it's not going to be accessible. But if the know-how passes to our partners, they will be able to make CAR Ts, they'll be able to make Clostridium difficile vaccines, maybe the CD5 liver for metabolic liver disorders like fatty liver disease. Sickle cell anemia, that's a problem of West Africa, first and foremost. That can be solved as well. But it can only be solved if it's being done by our partners at the price that our partners will be able to put this onto the market. So, Mohammed, thanks. I'll come back maybe for questions later, but I'd now like to ask 3 of our partners that are running companies, really, how do they see going from this concept of Children's Hospital of Pennsylvania, we've got some of these brilliant ideas, we're proving that this works in mice, we're proving this works in very small clinical studies. How do we convert this into products? So I'd like to first pass the microphone to Rajendra Burki, the Vice President of R&D for BioE in India. Rajendra.
Thank you, Martin, and it was a wonderful talk by Alame. It's nice to see the way how technology is progressing and curing the rare diseases. It was wonderful. Thank you for that. And we would also like to thank the WHO and MPP and all other stakeholders who has selected BioE as a partners in India. Given the phase 1 of the technology, we were able to adopt the technology that were developed and trained at Afrigen Lab. And we were in technology transfer at this point to scale that was demonstrated at Afrigen, and we are trying to demo that in biological E. So going forward into phase 2 of the program, that we would like to take help of the WHO and other stakeholders to establish the GMP laboratory and taking that into commercial scale. As you all are aware that the biological E has several vaccines that are being supplied to global scale, and we are well positioned in terms of manufacturing of traditional vaccines. So going forward, we would like to request WHO to come up with a framework to produce the mRNA products during the epidemic and pandemic, and also to support the vaccine approval pathway to various countries by supporting into the building the commercial facilities, and also which can make viable to produce the stockpiles during the epidemic and pandemic. So thank you, WHO, for such a wonderful partner to take these vaccines to the world.
Right, microphone. Thank you, Rajendra. I pass next the microphone to Fernando Lobos from Synergium Biotech in Argentina. Fernando, please.
Thank you, Martin, and thank you all for inviting us to participate in this important meeting. So very practical concepts that what we are doing in Argentina and Synergium Biotech. We already have a comprehensive understanding of the technology. We are finishing the process tech transfer. We already have the analytical methods already transferred. We have the people, staff, and trained, and we are building a facility to manufacture products. And actually, we are working on H5N1 development that we will finalize the preclinical stage in the upcoming months. So we are making great progress, and we are ready to increase the pipeline of our products to make not only sustainable our company, but also to be available to other partners. So it's great to hear all the other possibilities that we have in the therapeutics scenario. So one concept here is very important. We already made huge investments, not only, as I mentioned, in people and training and infrastructure, but now we need to invest in R&D and new product developments. And that's where I think MPP and WHO, together with the universities and other colleagues, may help us in bring products to our pipeline, and also to have the necessary and diverse funding avenues to support that at the earliest stage. We need that support to have pipeline, to have products, and then, as in our case as a private company, we can take that from there and go into the other clinical stages. But the initial risk has to be some way shared between us, and I think it's of a great value. Let me come back to one point that was mentioned earlier in this morning about collaborations. The inherent collaboration model of this program is key and is fundamental. We made great progress all these years since 2021 when we were selected, because we collaborated. We collaborated highly with and strongly with Afrigen. And in fact, I will share one story to you. We have the honor to receive one technical lead from Afrigen for 3 months. And the learning and the sharing of knowledge that she provided to our team was immense. And that means less money and less time for us. So those are very practical examples of how collaborating between us, we can accelerate timelines. So bottom line, we need products. We need support from you to get those products in the pipeline as soon as possible, because if we have products, the program is alive. And if the program is alive, we will be shorter in time to have products to our people. Thank you.
Thank you, Fernando. I'd like to ask Abdul Muqtada, the CEO of Incepta in Bangladesh. Abdul, you lead a big company. How do you see Incepta's ability to pick up some of these concepts and take them towards commercialization?
Thank you. Thank you, Martin. And I also thank WHO and this particular platform for giving us the opportunity to learn things which was absolutely unimaginable for us. And it has put us into a stage where we are able to do things which otherwise we would not be able to do it. And I would also take this opportunity to say, express our gratitude to all others who are involved with this particular process, whereby we are selected, and many companies who are able to learn these things, and especially Afrigen and Petra is just unbelievable. I mean, with her able leadership, our people, our scientists are extremely encouraged, and we are progressing a lot. Now, coming back to this mRNA technology, this is, in one point, this is a technology, but there are many other subsectors which requires very, very improved and guided manufacturing, like for example, enzymes, for example, the lipid nanoparticle making it, or any other way of enveloping the lipid mRNA particle, or making the mRNA and DNA, all kind of, these are the other areas there where we need expertise in order to bring down the cost. Incepta is working on every single platform, and we are actually making tremendous amount of progress. And eventually we'd be able to contribute to the whole ecosystem by providing less expensive accessories to make this particular platform successful. Now, coming back to another one issue, what Mohammed has been showing for the last half an hour is just unbelievable. Just imagine this particular platform in a developing nation. The ecosystem is not there. And the regulator is not even, do not understand, let alone giving them this permission of going ahead within weeks' time or a day's time so that he can perform all these experiments. So here we have to divide between the countries who has this ecosystem where we can have these clinical developments in those countries. And also other companies who has fantastic type of infrastructure to make many things. Like Incepta, we can make API, we can make organic synthetic compounds, we can make RNA, we can make enzymes, we can make all other things to progress, to take this particular initiative forward. This is what exactly we are doing, and we'd like to take it forward. Now, I could see from the morning, and probably all of us are quite aware that funding is still an area where it makes us, all of us, concerned. What we can do with our collective effort. We saw that, let's say, a handful of countries and institutions coming up and supporting this. Why not let's make an appeal to all the WHO member states, all the countries, from WHO to the head of state and also Ministry of Health, telling them that this is a combined effort by which we are actually taking a great technology platform forward. And with your little support, this particular initiative can bring a tremendous amount of success. In addition to that, many countries where our individual 14 or 15 members are working, there, I mean, the government is just inert and sitting idle. And if they come forward with a little bit of help, a little bit of financial policy support and regulatory support, these companies can make wonder. So I think together we should take such initiative so that we can bring in everybody into our concept, this ecosystem, so that each country, each government can support this particular initiative to make it a fantastic initiative and we become successful. Now, in order for the private companies to be successful, we need products. And there, many of us are progressing so that each one of us, wherever there is a success, it's the technology is shared and we take this combined initiative forward. I think it has a tremendous amount of potential, and the potential which is not yet recognized. And if we can keep this inertia of initiative moving forward, I think within a short period of time, we can actually bring in such a big public good for the whole world. It's just unimaginable. And I thank WHO, MPP, for giving us this platform so that we can speak, we can talk, we can have our ideas together, and we make this initiative a grand success. Thank you. Thank you, Martin.
Thank you, Abdul. So, Mohammed, I'm going to come back to you really for a final word. So, MPP has begun discussions with PEN and CHOP on the access to the IP, which I think is going forwards normally. But beyond IP, there's going to be the know-how. So could you just say a few words about how groups, either these groups that are here or their research institutes that they're working with, could, for example, learn how to make a CAR T cell?
Yes, definitely. So, and I have actually a couple of suggestions as well. But we have been active, and probably Afrigen can witness a bit about that, and even some people in Thailand. We have been very active at bringing people from these companies or even from research institute and training them in our lab. So one of the things that, for example, my lab and Drew's lab do is we're open to take PhD students, postdocs, research fellows, assistant professors, whoever wants to come and spend a year, even 2 years in our lab. We offer all the reagents usually and all the training, right? So we team them up with postdocs in our lab or senior research investigators to train them on how to think, how to do science, and how to develop and acquire this know-how that we are developing in the lab. So this is a program that we have been offering for everyone. Sometimes we also do offer a financial incentive by paying some of their fees, but mostly we're very open to get people from all of these companies and research institutes. So that's one thing. The other thing is we also are making actually a program where we have our own methods, for example, analytical methods for the development of CAR Ts or for gene editing that we are willing to share with people. But I think, Martin, that having people in the lab, right, that's the best way for them to learn. So we're very open for that. The other thing is just, I was listening and thinking, one of the models that I have been experiencing, especially at CHOP, it's a very vibrant environment. It's investigator-led clinical trials. And what I see with investigator-led clinical trials is a driver actually for product development and for companies actually to build a big portfolio and take those, because usually investigator at the hospitals, they want to do a small clinical trial, demonstrate that it's working, they want to help patients. And then at a certain point, they either decide to spin off this technology into companies or license it to other companies or find a venture capitalist who wants to fund this type of products. So what I think actually is companies such as Afrigen, Biological E, and everybody who's here should actually encourage, and even WHO and MPP should encourage actually in their own countries and through the network, hospitals or universities that want to do investigator-led clinical trials, so the companies are able to manufacture those, because that's one of the main problems. They need GMP grade material, right? So they can offer that, and then later on, when things develop, they can either license them for commercial use, or that just encourage actually the economical cycle of these products. So that's one idea that I just got from my experience.
Thank you. I'll just maybe just add a final comment onto that. We will be hearing later on this week, there'll be the session, I think on Thursday, we were doing oncology. The cost of doing oncology trials in industrialized countries is phenomenal. Sometimes 50,000 to 100,000 euros per patient. We will be hearing from one colleague who is doing trials at a cost of around about 1,000 to 2,000 euros per patient. So this offers an opportunity for the concepts that we're hearing about. CAR-T offers tremendous potential now to treat many cancers, from pancreatic, colon cancer, non-small cell lung cancer, brain cancers. So there's the huge opportunity there. We have the offer of the know-how from Children's Hospital of Pennsylvania, from Penn University. We have the opportunity of doing clinical trials at our partners in the LMICs. This is a win-win situation, where the LMICs receive the technology, are able to develop it further, and most importantly, having grown up in these countries, it's not fair that the West and the North, they have the therapies, and in the South we have to wait 20, 30, 40 years. With that, back to you, please.
Thank you. Thank you very much, Martin, and for the moderation as well as to your speakers. And we are transitioning now to the next session, which is on capacity strengthening. And first, we are going to see a video from Professor Drew Weissman, University of Pennsylvania. The video, please.
Thank you for allowing me to present to you today. I apologize that I could not be there in person. What I wanted to talk to you about is our program to give, to exchange, to supply modified RNA LNP vaccines and therapeutics to the world. Let me start with just a couple of examples of what RNA LNPs can do. We all know very well about viral vaccines, so I'm just going to highlight the comparison of mRNA LNPs to other standard vaccine platforms. This is influenza. Currently, influenza is usually given as an inactivated virus or a live virus to young children. We can see the superiority of the mRNA LNP vaccine, and we saw this with COVID-19 as well. Wanted to talk to you about some other platforms, in this case, bacterial. We developed a vaccine against C. difficile. And C. difficile, this is an overly complicated slide, but essentially what you need to see is that unvaccinated animals rapidly lose weight. But after the vaccines, and we gave 2 vaccines, bivalent and trivalent, I'll explain the difference in a moment, we see much better protection with very slight weight loss. Here we're comparing the two, and what the difference is, the bivalent looks at targeting only the toxins in the bacterium. The trivalent includes a bacterium-associated protein. And the idea here is that that additional response could clear the bacterium from the GI tract. And that's what we're seeing. The purple is the trivalent vaccine. And if you look over time, the animals reduce their toxin load in the GI tract, but it only becomes 0 in the animals that had the trivalent vaccine. And when we looked for the bacterium, it was gone from these animals. We've also treated animals, including Aeotis macaques, for malaria vaccines with good efficacy. Wanted to move on to another subject for RNA, which is autoimmune disease. We've all heard of CD19 CAR-Ts for the past decade that have been incredibly effective at treating B-cell leukemias and lymphomas. A few years ago, George Shedd used this lentiviral-produced CD19 CAR-Ts to treat autoimmune diseases, and he had incredible effectiveness. 15 out of 15 patients became drug-free in their cure. Now, of course, they had B-cell aplasia for 5+ months and numerous hospital admissions for a variety of adverse events due to the CAR-T therapy. We've proposed to use in vivo B-cell depletion with in vivo produced CAR-Ts because of the speed, the cost, the off-the-shelf nature, no immune depletion chemotherapy, and applicability to many other autoimmune diseases. So our idea is that we could target LNPs to T cells in vivo and encode the CAR as the mRNA. What then happens is that the T cells express the CAR for transient periods of time, and those T cells can kill whatever the CAR is directed against. Here we're now doing in vivo CD19, or in fact CD20, because it's macaques, CAR Ts in macaques. Animals were treated 3 times, and after the 3rd treatment, nearly 80% of all T cells, CD8s, expressed the CAR. What was most interesting, though, is when we followed these macaques over time. So control-treated animals, the B cells do not drop. The lymph nodes remain full of B cells. In a dose-response manner, we see immediate loss within 6 hours of all B cells and increasing lengths of depletion. But most interesting, in the lymph nodes, with increasing doses, we see complete dissolution, disruption, loss of B cells. When we followed these animals, their B cells came back within 3 to 5 weeks and came back primarily as naive B cells. So what this means is that we've reset the immune system of these animals. We've gotten rid of all of their autoimmune B cells that were driving their autoimmune diseases. This is now in human clinical trials, and we're following for amount of B cell depletion and control of their autoimmune diseases. We've also been able to target bone marrow stem cells. Thousands of diseases are caused by genetic defects in bone marrow stem cells. The principal one internationally is sickle cell anemia. We've developed a targeting technology that delivers the B cells to the bone marrow stem cells. Here we're gene editing a fluorescent protein, and we can see that after a single treatment, greater than 70% of the daughter cells from the bone marrow, red cells, white cells, granulocytes, are gene edited, and they remain gene edited long term. Here we're delivering a base editor that fixes the gene defect in the hemoglobin B gene of sickle cell patients. And you can see that with a single treatment, we've gotten rid of nearly all of the sickle cells. So we could effectively treat bone marrow stem cells in vitro and reverse the gene defect in sickle cell. We're now moving this to in vivo analyses in animal models. So the conclusions from potential uses of RNAs, it's very broad. We can make vaccines against multiple types of pathogens in all classes. We can do in vivo gene therapy, simply off the shelf and fiscally capable. We can do in vivo immunotherapy and therapeutic protein delivery, and we're working on targeting the brain. I wanted to now describe our program in equity. This is a disturbing chart of the distribution of COVID-19 vaccines by country. Brown is bad. We can see that Africa had the least amount of distribution of COVID-19 vaccines. Our equity program seeks to correct many of these attributes, stemming and starting with basic research, GMP production. The WHO has already built 15 GMP sites. We're going to bring those into compliance with current therapeutics, including targeted delivery, clinical trial development, regulatory approvals, and distribution to the population. I want to play a short video.
In its first year, the COVID-19 pandemic killed over 3 million people. Once effective vaccines based on new mRNA technology became available, billions of doses were produced and distributed, but mostly in Western countries. Low and middle income countries that could not afford vaccines were left waiting. We are working so that never happens again.
The concern that it could take years for Thailand to get access to effective vaccine, we developed our own COVID-19 vaccine. This was made possible by a long-standing collaboration between Dr. True Weissman and our Chula Vaccine Research Center. We are now developing 10 more vaccines for use in Southeast Asia. Building on the success of mRNA technology in the West and in Thailand, the World Health Organization has begun working with Professor Weissman to support GMP manufacturing facilities in 15 countries. We propose to extend new research for mRNA vaccines and therapeutics in LMICs throughout the world. Our program will also include basic science research, developing regulatory expertise, GMP production and quality analyses, and capacity for clinical trials. One goal, one mission, to enable the power and promise of RNA technology and apply it to the most pressing health problems across the world. So you all know about South Africa's mRNA hub and the 15 GMPs that it's produced so far. We want to start to take this further. Our in-country goals with this equity program are for each LMIC partner to train initially 10 to 15 local trainees in RNA LNP clinical trials, development of basic science research, regulatory experience, all elements necessary. We have a 3-phase program. The first phase is to build basic science research. This means working with academic universities in each country to develop RNA therapeutics and vaccines. The second phase is to develop worldwide regulatory expertise in clinical trial development. This will allow each country that develops new vaccines and therapeutics through their basic research to test these vaccines and therapeutics and develop them. The third is to develop programs for distribution and IP access. The IP access, in our view, is the most important aspect. The University of Pennsylvania, and working with other academic institutions, will make all of our vaccines and therapeutics available to low and middle income countries through licensing at no charge. This will allow both basic science and clinical trials to begin development of RNA vaccines and therapeutics in their home countries. Finally, working with medicine patent pools, we will manage the IP from all of the individual countries and what the United States and European countries are donating to allow free access across the world. Thank you very much.
Thank you very much. I hope we all followed through, and I think there is a good system in terms of how we should be thinking about the potential benefits from this technology. I think if you're looking at, for example, gene therapy, if you're looking at multiple vaccines being possible under this platform, I think really we are looking to a future with bright possibilities. For this moment, I would like to move to Ike James to set the scene, and I also ask Ike to lead through our conversations with Morena, Indra, and Marangelique. Ike?
Thank you so much, Zachary. Yeah, so the focus is capacity strengthening. And to do that, I really want to focus on 2 slides that Charles showed earlier this morning, just to recap. So Charles shared this slide, and I think it's really noteworthy because if we consider that the mRNA program was launched in 2021, and a year before that, there was no mRNA capacity in any of our partners. And if we fast forward now to the end of 2026, we have 15 partners having demonstrated that they can have the knowledge and manufacture mRNA, with 15 of them being able to perform R&D activities and up to 6 being able to manufacture GMP clinical grade material. Fast forwarding that to 2030, with continuous support, it is estimated that this will be able to increase to 10 manufacturers being able to manufacture GMP grade material. So in essence, what does this translate to? Next slide, please. Charles shared the screen as well, and I just want to emphasize this and maybe pause a little bit of it. BioVac is currently scaling up the process that was transferred to them by Afrogen. They are scaling this up to 10-liter IVT scale. This translates to approximately 313,000 doses per batch. 313,000 doses per batch. That is not a small scale operation. And if we were to take a total of what that would come to across 10 manufacturers, that's more than 140 million doses yearly. With continued support in industrialization, scale up, and integrating next generation technologies, we could see this increasing to approximately 1.9 million doses per batch, okay, which totalizes 1.9 billion doses per year. Okay, but this intervention, this improvement requires investment, okay, and investing only based on pandemic products is not sustainable, okay? Why would you build these facilities, pay money to keep the lights on when you've got no product in these facilities? So the program really needs a sustainable business plan required to keep the lights on during these interpandemic periods. But for what products? Next slide, please. So this really emphasizes that we need to know what products and for which markets before building these large-scale GMP facilities, okay? With defined product pipelines, capacity building becomes targeted, efficient, and investment ready. Next slide, please. And so the purpose of Pillar 2, focusing on capacity strengthening, is really looking at turning shared technical capability into sustainable manufacturing capacity. It's also looking at supporting industrial scale-up and pandemic response readiness. We need to do this by developing and retaining a skilled workforce. So the qualified workforce, be it for GMP production, quality assurance, quality control, and regulatory compliance. And while doing this, leveraging shared assets across partners for efficiency and resilience to create synergies and reduce redundancies. And all the way ensuring that once viable products and business cases are identified, capacity investments deliver long-term stability rather than a one-off project. Next slide, please. So when we when we link up Pillar 1 and Pillar 2, you can see they're quite interconnected. Where Pillar 1 was about sustainability and Pillar 2 was about capacity. But what it really talks to is Pillar 1 is defining what to make. And Pillar 2 is really looking at how are we going to make it. So when products have a clear regulatory and market pathway, partners can determine the right-sized capacity needed in terms of their manufacturing facilities. How big should their bioreactors be? How big should their filling lines be? How big must their analytics team be? With this information, our partners can design cost-effective facilities and not go and overspend, over-engineer facilities. They have the information to design their facilities appropriately. And this enables them to present a bankable investment cases backed by real demand. And this will result in building facilities that will serve specific sustainable needs during interpandemic periods and ensuring long-term viability. Next slide, please. This is my final slide before I'm going to turn to the manufacturing partners. So the real aim is that by 2030, we need sustainability. We're looking at up to 10 partners reaching operational mRNA manufacturing for interpandemic sustainability, but also allowing able to respond to future pandemic responses. And in doing so, from now, we need to be able to define our products. We need to target the capacity, and we need sustainable business models. And with that, I'm going to turn to the manufacturing partners and ask them their opinion on where they're at and how they see this journey unfolding. So firstly, I turn to Dr. Morena Makona from BioVac, the CEO. Morena, are you online? Can you hear us?
I am online. I'm just trying to get my video going. But can you hear me?
We hear you loud and clear.
Okay. Just not sure why my video is not going on. Let me just try something else. Look, something happened there. Sorry, just a wait. Apologies.
No problem. Take your time.
There we go. Okay,
right.
can you?
Hi, Morena.
Okay.
Good to see you.
Okay. Yes. Firstly, good afternoon to you, Ike, who's facilitating this discussion. But I think more importantly to the people around the room, apologies for not being able to make it there in person due to some conflict in diaries. But I am represented by two of my colleagues in the room, being Shonette and Ibrahim, who I'm sure will be there to interact and answer a lot more questions. This morning session and this early afternoon session has been quite interesting. I've been listening intently, and also like to just say congratulations to firstly Afrigen, and I'll expand a little bit about just how they are empowering us, but also to the other manufacturers that have spoken now, and I'm sure many others will speak not only today but in the other sessions that will follow in the next few days. At BioVac, the mRNA program has been an extremely valuable platform. Just to mention perhaps what is the obvious, but perhaps to some, I think it's worth repeating that the likes of BioVac were only reliant on one platform prior to the mRNA hub and its program coming through. And we're largely looking at the bacterial and the fermentation platform. The mRNA hub has allowed us to enter into a new platform, but also through the network, and I'd like to share others that have spoken before me around the power of the network. Tomorrow, the team is going to explain the achievements thus far that we have done in trying to optimize and scale up the process. That can only happen if you have received the technology from a reliable partner. You can only optimize or you can only scale up that which you've received from a partner. And that's where I think Afrigen has played a very important part in setting a lot of the foundations, and I know under extremely difficult conditions. And so the results that you will see tomorrow, the scientific information that we'll see tomorrow around the progress that we've made can only be with the support of Afrigen, MPP, and WHO in us being able to achieve. And I think a lot of that information is going to be shared also with the rest of the partner. So I think the question is, where do we go to now, particularly with the elements that you have now described? So I think it's important that, and I'll speak from a South African perspective in particular. South Africa has not developed products, unlike many of our DCVM partners. Afrigen is doing its good work. We are doing another project that I think many of you know of about cholera. And what both of us are doing on the capacity and the regulatory side is that we are doing first in South Africa in terms of trying to pave the way for R&D products to get into the clinical element. So AFRO is doing its part, which I think everybody knows of, and they've been working closely with the regulator, which is the first in terms of what they are doing on a new platform that even the regulator is learning of. We are doing our part on a different product, and we've just gotten our clinical trial approval to take that product through the process. So whilst it may sound very simple, but I think part of this program that is doing is around that capacity building, whether it's about optimization or it's about paving the regulatory pathway, so that when we do come up with those products that you're mentioning, Ike, that will make us sustainable, that a lot of the capacity building and we have paved the way from a skills perspective, from an infrastructure perspective, and from a regulatory perspective. But I do want to share the sentiments that we do have to have products that are pandemic and outbreak ready, because we are going to have those type of products. But we also need to look at pipelines on products that can be routine products so that we can manufacture them on a day-to-day basis. Obviously, the big issue is the cost that comes with it. And that's where we want to optimize the process to reduce the cost. But also, we can only do it also through the network, with what we've just heard from others, trying to help us to reduce the cost and make sure that we have the products that are coming through. So we are excited about what is coming down the line. And as much as we don't have a candidate as we speak now to take us to the next phase, but I think we are suitably primed from an infrastructure perspective, from a product development perspective, and from the regulatory path that we have paved, both collectively with AFRO locally. South Africa and SAMRC is an ML3 country, which is one of the few on the African continent. So I think a lot of good work can still continue in partnership with the rest of our brothers on the continent, but also with other DCVMM partners. So I'll leave it there for now. Ike, and happy to take questions later on, or my colleagues on the floor can then answer particularly the difficult questions. Thank you, Ike. Over to you.
Thanks, Morena. And thank you for that insight regarding the regulatory pathway. I think that just to re-emphasize that is key, definitely in South Africa and areas of some of our other partners. The other important part is both pandemic-ready products, but also interpandemic products. So definitely aligned with you there. We'll leave the difficult questions for Shanette and Ibrahim. So with that, I'll turn over to Dr. Indra Rudyansa, the mRNA Program Manager at Biopharma. Indra, over to you. Your insights on where Biopharma are and what your plans going forward are.
Sure. Thank you so much, Ike. First of all, I would like to say thank you for WHO, MPP, and the funders for inviting us to this very important meeting. So this program has become our core in mRNA building, capacity building at Biopharma. Back to 2021, we don't have any experience or capability in producing or experiment with mRNA. Now, following the intensive tech transfer from Africans, we're able to produce not only for small scale, but we can produce the material to be for preclinical trials. And soon we will produce mRNA that can be used for humans in the clinical setting. So importantly as well, based on the knowledge that we have so far, we're able to expand our capability as well outside the programs. We experience other in manufacturing systems with quantum, and also we're able to develop our in-house pDNA manufacturing that can support our mRNA program at Biopharma. And hopefully this can be shared as well with the partners to support their program too. Importantly, this program has become a catalyst for Biopharma to collaborate, to partnership with the other organizations, and we gain support as well from the government. We have received some investment from government to establish the facility, not only for the pilot scale GMP, but also for the large scale capacity. We also enter into network with collaboration with CEPI as part of CEPI vaccine manufacturing facility network. And we commit to reserve our capacity for some certain person and able to produce for the pandemic vaccines during the outbreak or pandemic. So we also have a facility that need really to be established as a GMP facility, and by the support from AFRIGEN and MPP, soon this facility will be established. And this collaboration also has, I think, become an insight for the other initiative to support the sustainability of the program. For example, with PATH, we collaborate to produce, to establish arena cooperative within the partners in order to accelerate the molecule for the first human trials. We also develop a bilateral collaboration soon with Synergium in order to excel and sustain our capacity and also sustain our capability in mRNA vaccines. And also looking forward next from here, we are ready to welcome the WHO MPP mRNA Technology Transfer 2.0. With this capability that we have now, we're confident that we can accommodate this mission. So thank you.
Many thanks, Indra. Maybe some full disclosure. The MPP team were at Biopharma about 3 weeks ago, and we were able to see firsthand the progress that has been made. Not only have you managed to obtain full R&D readiness, but your GMP for clinical trial manufacturing is well on its way, and your plans for further expansion to full commercial scale is also in plan. So that was all very, very noteworthy.
Thank you, Ike. And yeah, we'll be looking out for Marangelique. We'll try and squeeze at some point as it becomes possible. For now, I think I'm going to also hand over the reins to Claudia to run us through the session. Claudia?
Thank you, Zakaria. And I'll briefly introduce this pillar 3, as we call it, the program integration part, and I'll give the floor later to other colleagues. There is a presentation, perfect. So, so far what we have seen is how the mRNA program has built the foundation of manufacturing capacity, from developing a sustainable product pipeline under Pillar 1 to strengthening technical and regulatory capacity under Pillar 2, as we just heard. Now let's look at how to make these investments sustainable and impactful in the long run by integrating them in the health and innovation ecosystems. So really, Pillar 3 is about moving from the can manufacture to can actually deliver, ensuring that the capacity we build becomes part of a living ecosystem that connects innovation, policy, and public health delivery. Integration really means ensuring that each manufacturing partners, and we have heard from some of them, is not an island. It is connected to its national research ecosystem, potentially regional procurement mechanisms, and for sure, global response frameworks as in the event of a pandemic. And WHO and MPP role is, as we see it, is to convene, connect, and enable, ensuring that the lessons that AFRIGEN has learned first and that are being shared with the rest are flowing across this network, and also ensuring that this model, for its good parts, can be adapted to other emerging technologies. So we can move to the next slide, where we really try to understand why integration matters. And it's true that without integration, manufacturing risks remaining an isolated technical success. Integration turns it into a system-wide achievement. It's the bridge between capability and impact, and it's the stage where local manufacturing capacity meets the real-world delivery through health systems, supply chains, and policies, especially for procurement and use. It is also how we make the mRNA network self-reliant by embedding it into existing structures, as I said, from procurement and stockpiles, for example, to research and market access. We can move to the next one, where we look at the 5 dimensions of integration. The first one, the supply chain resilience, is really trying to reduce dependence on imported raw materials and building regional sources for key inputs like lipids and enzymes, as we have heard from the scientists so far. And this is not only about security of supply during crisis, but it's really about creating regional economic value and reducing the costs over time. The second one is aligning the mRNA pipelines with health systems, meaning that products under development should connect to regional procurement mechanisms and delivery networks. And that's how we make sure that these vaccines and potentially therapeutics actually reach the population they are designed for. We have heard more than once about regulatory readiness. That is the third element of integration, where leveraging the strengthened regulatory capabilities that under Pillar 2 we will continue to work on. This will ensure harmonized and efficient pathways to product registration and, in a pandemic, also to emergency use. And this also supports a faster market access in the next emergencies. And the final 2, innovation and market ecosystems, linking with academia, R&D networks, private sector innovation hubs. This is where the mRNA manufacturing remains a dynamic, competitive, and part of a broader innovation landscape. So integration also means creating viable market access strategies because a strong demand forecasting and introduction planning can help this manufacturer to identify where to drive their own investment to sustain production beyond the idea of pandemics. The last slide is really summarizing the key messages here. So program integration is about ensuring that local manufacturing doesn't end when donor funding ends. And as we heard, by 2030, we want to see not just local production, but locally owned, regionally connected, and globally relevant manufacturing systems in these countries. And that means that each of the partners will be able to sustain themselves and contribute to regional health security. These pillars also, if you want, reflects the WHO broader commitment under the pandemic agreement. We heard this morning from Ambassador Amprou that went through the whole negotiation process, how this program, it's a practical implementation of what Article 10 and 11 talk about sustainable local production and technology transfer. And it demonstrates how the mRNA program is not a standalone project, but it's a practical implementation of global commitments. So to sum up, integration is what makes the mRNA program more than a transfer of technology. It's about creating systems that can innovate, produce, and deliver before, during, and after a pandemic. And it's the bridge that turns capability into resilience and manufacturing into public health impact. So I stop here, and I'm very glad to give the floor to Willow Brock, that is the CEPI liaison officer here in Europe, for his take on integration and how CEPI and this program, WHO, NPP, and this program have been working together also on the pandemic angle, pandemic preparedness and response angle. Over to you, Julia.
Thank you, Claudia. I think most of you are aware, I might hope, about CEPI. Maybe on the next slide, just to give a bit of background on why this is so relevant to us. We've built a portfolio of over 3.5 billion in investments. And I think one of the things to come back to the slide that Charles showed early on, and not wanting to diminish the ask and the importance of the ask of 17 million a year. I think the slide mentioned a 100 to 200 million investment proposition for getting a vaccine through phase 2, 3. And that's, I think, a slightly optimistic assessment in some cases. And that's the area that we really focus on a lot. And quite successful since our launch 10 years ago. We launched 8 new vaccines, 5 of them were COVID, including the support that CEPI had given to Moderna from the beginning on the mRNA platform. You also see that that takes a village, as I think Petro was saying. Just in the EU, we have 140 academic, industry, and government partners, and those need to all come together. So I think what we do here is build a platform that serves an enormous ecosystem of partners, as we already heard. On the next slide, just to, as we all like these triple standards, we do prepare, transform, and connect. But the important here is that in order to reach a mission statement of, and our vision of a world where epidemics and pandemics are no longer a threat, we need to talk about speed. It was mentioned already a little bit. This is sadly hard enough when we think about just creating the technology. In order to be successful, we also need to act incredibly quick if a pandemic breaks out. And that is an area where more and more of our investments take care of, not just looking at the technology, but also how quick can a technology adapt to something new or something that has changed. And on the next slide, you see basically why. This was modeling that was done by London School for work under the ACT Accelerator at the time, and where we assessed that if our 100-day mission, which is sort of the framework that CEPI has sort of adopted based on the input of many of you also around the world, we could have saved 4.8 million lives in COVID if we would have been able to respond not in 326 days, which we already decided was pretty magnificent, magical, and almost well, unlikely to have ever seen before. But also we could have prevented another 800 million infections and 15.7 million hospitalizations. So the reason for this idea to create this sort of incredibly ambitious mission is really one and created in public health, disruption of society, etc. Is that possible? And I think the answer is yes. The question is just not about doing it in 100 days, just making sure we prepare to be that fast when something happens. And I think that's what we're all doing here. I mean, people at this moment in time in the outside world might not realize, I think it was mentioned by Heidi, it is important to realize for the outside world that all this time and effort we're playing now is going to pay off in an event of an outbreak. Sadly also, which we should also realize, and when we talk to each other for sure, but also to our overlords and our financiers, is that the more successful we are, the least likely the outside world will see what is happening. I've been talking to quite a few people over the last couple of months about the Marburg outbreak in Rwanda in November. And most people say, what Marburg outbreak in Rwanda in November? And the answer to that is yes, see, that is what happens when you do it well, that the rest of the world doesn't need a massive outbreak. And there are other examples of this as well. On the next slide, we come to this question of what the infrastructure looks like. It's not very light on the screen, but what are some of the key areas if we want this 100-day mission to be successful? And this is not all the work that we as CEPI see as our core mandate, but what needs to happen in the environment that we need for success and where at least we keep an eye on. So first of all, it's obviously global disease surveillance and global early warning systems. And I haven't heard that today yet, but it's important for industry to know where outbreaks might happen, how big they would be, to be able to quickly respond. It's important that for us all to plan for success, that this is an area we keep track of. In the same way, when we talk about innovation, which we quite a lot about, sorry, already in this afternoon, simple speeding up identification of immune response markers for vaccines. What is the core of some of the work that we do? A lot of people here are there, but this is really the essence of the early stage, the sort of basic science we require to make a successful vaccine. In order to be ready in 100 days, we can't wait until a new pathogen appears or a variant appears. What we see as a work between all of us is also creating vaccine libraries. How far can we already be ready for a vaccine that can either be used during an outbreak, may not be fully regulatory approved, but has all of its protocols in place, has data collection policies in place, has the actual stockpile, but of an investigational stockpile rather than an approved stockpile. With everyone already sort of thinking about how would we use it during outbreak. That was part of the success of the Marburg exercise that we did in Rwanda. But if we can do that across all the viral families that we've identified as core threats, then we are way further ahead in being ready. Establish global manufacturing, of course. I'm not going to say anything more about that. We talk about this for 2 or 4 days, depending on who is here. Obviously, clinical trials and laboratory networks are essential both for surveillance, for the research, and also for the successfulness. So I think we all need to keep an eye on these areas of work as well. Because without the clinical trial networks ready at regulatory approval, I heard, Martin, you mentioning some of the improvements we can make in the cost of doing clinical trials when we think about it more from a global public health point of view than on a, let's say, commercial item. I think you might be a tad optimistic, I would say. So we might want to put a little bit of thinking in this, but you are right that there is a factor 10, maybe 100 in some cases that we can achieve if we're making sure we're ready for clinical trials rather than having to do it in an emergency situation in no time. And then I think the last point, which we haven't heard about much here yet, but is very relevant given current political discussions, is biosecurity and biosafety. All of us have a requirement and an obligation to ourselves, to the world, to ensure that the highest standards of biosafety are met. But that is also very important because with the progression of the science, the knowledge, the AI that we see around us, anything that can be used for good could potentially also be used for a negative situation. CEPI a couple of years ago received support from the Canadian government to ensure that we are not inadvertently creating the pandemic that we were set out to avoid. That was a first step in us realizing how much work there's to do for all of us to come to standards to ensure that we are all working according to agreed set of standards without, and that is, I think, a very important part from our side, that this creates effectively a barrier to competition, where maybe very high quality, few labs and manufacturers in Europe or North America could produce something according to the standards we set, and then crowding out anyone in the world, including all of the partners we're trying to see. So I think this element of biosafety and security, enabling everyone in the production and manufacturing and research on those standards is very important. And that all, as we all said, and these are all simple words on a slide, supported by enabling regulatory policy and financing architecture. Just a simple sentence, one says it very easily, but enormous amount of work. And that's that infrastructure in which we all operate. So what does the future hold? I think there is still a renewed commitment to vaccine access and equity. I think we all need to protect that because it gets a little bit less attention, but I do believe it's still there. Our actions today and the work that we're doing, as I mentioned, will determine health security in the future, our resilience for future generations. What we don't need is a sprint. The 100-day mission is not a sprint. The 100-day mission is a speedy race after a marathon that we're currently all running. And I think that needs a longer-term investment. And I'm quite happy to see, for instance, a situation that Charles mentioned, sort of thinking about how do we get to 5 years in which we don't need this basic infrastructure, but we also need to realize any pandemic essentially is going to be a market failure. So also for all of our manufacturing partners here in the room, by default, the better we deal with pandemics, the more of a
market failure it is. So we need to think about very smart ways of funding in the future. Because if the outbreak is smaller and smaller, and if we can respond quicker, we need more specialized systems, and therefore more of a global goods approach that I think was also mentioned this morning by Heidi and others. Now, a final word, the transfer hub itself in Afrigen is not something that CEPI has directly been funding, but almost all of the partners are our partners, including Afrigen itself. We have 2 programs with Afrigen. We have programs, as was already mentioned by Biopharma, with Institut Pasteur. We have Biomanguinhos. All of us, our success has been relying so far already on the hub and will continue to do so. So for us, it's really important that this approach and this platform continues to operate. I would be at loss to say that billion plus investment you need to actually get the vaccines, which we support heavily, but based on pooling of a funding of many of you on the room is also needed. So this is not, any one of us is claiming for a one-shot wonder, sadly. It would be great if it was the case, but we do need to work all together and making sure we get there. So I think let me stop there, and because we want to hear from some of our partners, including Biomanguinhos, and I'll give the floor back to Claudia to lead us there.
Thank you, Willow. Indeed, integrating this program into the health and innovation ecosystems at national and regional level is key. And so we will hear now from a couple of our partners that have embedded in their own daily work this integration at national and regional level. The first one is Patricia Neves. She's the project manager of the Regional Hub for Development and Manufacturing of RNA-based vaccines in Latin America that has been set up at Biomanguinhos. Patricia, over to you.
Thank you, Claudia. So I would like to thank, of course, WHO and MPP for this invitation and for being part of this such great program for 4 years now. And it's a pleasure to talk about my institution, Biomanguinhos. And we have a very particular feature in Brazil and very particular position because we are a governmental institution under Brazilian Ministry of Health. And for almost 50 years now, we have a key role in producing and developing vaccines, diagnostic kits, and biopharmaceuticals that support Brazilian health programs. Some of them are the most successful globally, such as National Immunization Program and HIV Treatment Program. Through this strategic partnership with Ministry of Health, Biomanguinhos ensure universal access to essential immunobiologicals for Brazilian population. We produce more than 200 million doses of vaccines and products per year, including yellow fever vaccine, polio vaccine, meningococcal vaccines, and during the pandemic's COVID-19 vaccines. And we are a reference center for innovation and biological products technologies across Latin America. And talking particularly about this program that's entering the 2.0 phase as one of the partners of this WHO program. And thanks to this knowledge network that my colleagues already shed light today, Biomanguinhos has invested a lot strongly in building a national RNA platform. Today, we are able to go since the product design with a patent filed last year about the Brazilian RNA platform and to pilot scale GMP manufacturing. So we are one of the 2 that we are able to produce GMP material. And our pipeline today includes vaccines targeting emerging viral diseases such as monkeypox and European fever, which is now in emergency. It's in our region in Latin America. Neglected tropical infections such as leishmaniasis and exploratory programs in cutting-edge therapeutic products. We just approved a project for developing in vivo CAR-T and CAR-NK products. And we are actively discussing with our Ministry of Health to prioritize these products for Brazil and our region. Our platform integrates LNP formulation, analytical development, and cold chain logistics, enabling us to advance candidates rapidly from concept to clinical evaluation. We equipped the first GMP facility for RNA products in Latin America, and we are about to start our clinical phase 1 for the COVID-19 vaccine developed in Brazil. And if you want to ask me why COVID-19, because in Brazil there is still interest in this vaccine, because this is included in our national immunization program for risk groups and annual vaccination. And beyond national borders, Biomanguinhos is committed to regional collaboration and capacity building. We work together with PAHO, WHO, MPP, and partners institutes in Europe, Latin America, and Africa to strengthen regional self-reliance in vaccine production and to share know-how in RNA technologies. We have just signed the contract with MPP and Afrigen, an MOU to work with Mexico, and we are discussing other regional partnerships through PAHO with Panama and Colombia, besides knowledge exchange with other countries, such as Senegal, Tunis, and Kenya. We are also working to improve supply chain in Latin America, actively looking for partners to bring lipids and other raw materials production to our region, because we know it's very important, since we could be able to develop and produce RNA products. But if we don't have supply chain in our regions, it will not be enough to respond to other emergencies. And together with CEPI, we are also working in regulatory preparedness and exercise with our regulatory agency, Anvisa, and we are also one of the centers for preparedness in Latin America. I will dive deeply in these points tomorrow during my presentation, but in summary, Biomanguinhos combines a public mission because we belong to the government, scientific excellence because we are part of Fiocruz, 125 years public health institution dedicated in Brazil, and the strategic innovation to position this ecosystem at the forefront of RNA products development and to increase global South health sovereign. Thank you so much.
Thank you, Patricia. Indeed, the demonstration of the full cycle integration into at least the national ecosystem with a strong government commitment to public health and local manufacturing. Let me move now to Ivana Lukic. Ivana is the head of immunochemistry department and the project manager for the mRNA technology transfer at Torlac. Please.
Yes. Thank you very much. Sorry. Thank you very much. Good afternoon, ladies and gentlemen. It's my pleasure to speak today to you on behalf of the Institute of Virology Vaccines in Torlac, Serbia. First of all, I would like to thank organizers for the opportunity to present our program integration. Over the past 2 years, we have significantly enhanced our facility readiness and infrastructure. Despite some supply chain delays, we managed to procure all necessity equipments, reagents, and consumables for this project. And also our staff gained strong technical expertise in mRNA vaccine production and training in international hands-on training centers in South Africa, South Korea, US, Europe. Also, we have initiated the development of mRNA vaccine candidates with promising preliminary results for mRNA vaccines against rabies. And also, we have a new project launched for West Nile virus and influenza. In parallel, during this period, we have strengthened our partnership through major initiatives such as European Horizon project entitled Vision, focused on strengthening of workforce in biomanufacturing, and a scientific project entitled Redirect that we have with the collaboration with Faculty of Medicine, University of Belgrade, Serbia. This project is focused on the investigation of role of macroautophagy in mRNA vaccine delivery and adjuvanticity. Additional program that can contribute to this mRNA platform is our new diagnostic and research facility with biosafety level 3 laboratories. However, if we are talking about program integration, this process wasn't an easy, and along the way we have faced numbers of challenges. The first one was related to the public procurement for the specialized regions and consumables. And to address this, we established coordinated procurement channels and developed strategic partnership with specialized partners. Additional challenge was a local limited experience in mRNA transfer, in mRNA technology in general, but we mitigated this with those trainings that I have mentioned. Additional challenge for us is setting GMP compliant complement facility, because our approach was to go gradually scale up from non-GMP to implement this technology, and after when we find adequate mRNA vaccine candidate, to go further and to establish this GMP facility. And also with respect to licensing and regulatory approvals, we maintain continuous alignment with the regulatory guidelines and trying to secure funds for licensing for the future vaccines. And looking ahead to 2030, Institute Torlak is focused on innovation. We are continuing to develop these vaccines, and we hope that those candidates could be on the market one day. And to ensure sustainability, we are going to strengthen, like I said, the GMP facility, and GMP capacity, and maintain our staff trained. Our progress currently is supported by our government and the Ministry of Health and Ministry of Science. And if we are talking about the future, we hope that we are going to initiate new projects that can be also contribute to that can also be relied on mRNA technology. We already applied for funds for research for a circular and self-amplifying influenza pandemic vaccine. And we also applied for funds for anti-cancer vaccine, and we hope that we can have that project in collaboration with the Faculty of Medicine, University of Belgrade. In conclusion, I would like to express my sincere gratitude to funders, to WHO, and especially to Medicine Patent Pool for their continuous support and guidance through this exciting journey. Thank you.
Thank you, Ivana. And so, Zakaria, we are at the end of this session. The idea is really to ensure that we move forward, bringing first of all the governments where this technology is being transferred. And I think again, Ambassador Ampruk this morning was talking about program integration, and she had 3 elements that need to be considered. First of all, it's local ownership. Then she mentioned again regulatory system strengthening, and the third one was the available skilled local workforce. So indeed, these 3 elements are the one where we see the program focusing for the next 5 years. So thank you to the speakers here for bringing this perspective to the table. And tomorrow we will discuss even more.
Thank you. Thank you so much, Claudia, and to the speakers. And at this point, we have a few minutes we've moved quite efficiently. I hope the program can move this efficiently going the next 5 years. So at this point, I'm happy to take any burning comments or questions from anyone in the audience, in person or online. Just one before we break for, yes, thank you. I can't see the name, sorry.
Yeah, Manuel Batz from GIZ. I have a very basic question, really basic to Muhammad. I mean, you talked about your scientific work and you're at the cutting edge, I would say, in the US, in therapies, innovation, and we talk here about mRNA, yeah? And I'm just curious to learn or understand your perspective. Where do you see the mRNA technology in the biologics therapeutic space in 5 to 10 years? I mean, today we have the COVID vaccines approved. It's the only commercial products. Others are all in the pipeline. And yeah, what is your perspective?
Oh, yeah, sorry. So I do believe that the mRNA therapeutics as a whole will be taking a large proportion of the drug development pipeline. I think in the next 5 to 10 years, a lot of the personalized cancer vaccine will be based on mRNA, and also most of the gene editing approaches that you will be seeing will be based on mRNA. From a vaccine perspective, I think there will be a lot of vaccines based on mRNA, but I don't think they will follow as fast as the therapeutics, at least in the developing world. And that's because of the profitability and the cost of manufacturing. So for bacterial vaccines, viral vaccines, those are like, the margins are very low. So people are moving more towards cancer and gene editing. From antibodies, I think there will also be few products, but I don't think it will be as fast as the cancer vaccine and the gene editing products because of the issue of re-administration IV, at least for now. Thank you.
So this part of the program is a panel discussion on the pillars of the mRNA Tech Transfer Program. And this is going to be co-moderated by myself and Gilles here. We're going to share the conversation as we proceed. With that being said, I think I'd like to invite Gilles to take up the first part.
Good afternoon, everyone, and I'm going to wake up the room a little because you've had your coffee break and it was supposed to be 15 minutes, but I think you realized you took a lot longer. But that's fine. We're going to make this session a bit more interactive and dynamic, and so we have an esteemed panel who's with us, spread out around the table. So with us is Cécile Billot, who's sitting over here on the right, who is the unit head and director general for IMPTA. So welcome for being with us this afternoon. Next to her, but slightly over, is Olivier Girard, who is the unit head for the European Commission Health Emergency Preparedness and Response Authority, HERA. So thank you, Olivier, for joining us. Also next to him on the other side is Leonidas Nieva, who is here from TESS MAV+. So he's also joining us as well. So we have a good European voice, strong European voice here this afternoon. Online, we have Nkechi Mbeni from International Vaccines Institute IVI Africa region. So good afternoon, Nkechi. I understand that Macky Song, your colleague, is currently in transit and that you will be representing him here this afternoon. So glad to see you there, Nkechi. Also, we have online with us, we have Mina Louis Okwebele from Africa CDC, so representing there. So again, Mina, I saw you online, so please, if you would like to turn on your camera too, that's fantastic. And then also from Gavi, we have Yalda Momeni. So I also saw you on the line, Yalda, so we'd like to invite you as well to put on your camera. And that brings all my panel then here together. So you've heard today about the 3 pillars, pillar 1, 2, and 3. So how do we go from, what is it we have to make, what it is we have to do to make it, to finally making sure it's on the shelves. And we'll start with strategic pillar 1, which focuses on building a sustainable mRNA product pipeline through strong R&D partnership. So prioritizing new product candidates, developing viable business models, and enabling technology transfer and investment. So it's a big ask as well, and something that the program partners, as you heard also today, are well on the way to working with. And so my first question goes to Cécile Billot. So for you, Cécile. So IMTA has played a key role in supporting health innovation in Africa. What is needed to ensure that the African mRNA manufacturing in this program can assess and develop a sustainable product pipeline, one that is regional relevant, commercially viable, and well integrated into the continental health priorities?
Yeah, thank you very much, and good afternoon, everybody. Very easy question to start with. But basically, as European Commission DG INPA, we've been supporting the Africans' manufacturing agenda since 2021 after COVID, and really this call for more production in Africa. So we've been really working together as Team Europe with many of our EU member states, France, Germany, Belgium, of course, that is hosting us today, Spain, Sweden, Netherlands, also Luxembourg, to really design activities to support this agenda. And we call it Team Europe MAF+. So I'm sure many of you have heard about it. But what does it mean in concrete for what we're talking about today for supporting the pipeline on mRNA? So the vaccine side, MAF+ is not only on vaccines, it's also other pharma products, but for these vaccines, mRNA production. Basically, there are 3 different types of activities that we are trying to do and design with our African partner. And of course, on the supply side, trying to provide innovative financing instrument. Also, that is really there to help to get the investment going, investment for research, but also for manufacturing further down the line. We have especially new, well, it's not that new, it's more than a year old, but now a tool which is really starting to deploy, which is called HDX, Human Development Accelerator, which we work together with EIB, European Investment Bank, and also the Gates Foundation, and which provides really venture debt, loans, and a bit of TA and grants to really support this agenda. And this is guaranteed by the EU, so it allows the bank and the investor to take extra risks, so to go into this type of operation that may not find basically the investment on the market. So that's one of the tools, and we are having also others, but really trying to look at how we can help to mobilize the financing side and the supply side. Then, of course, there is a demand side of it, which is a difficult part too, but where we have also trying to act and to support the demand, because it goes together. But then there's also the third element on the ecosystem, which is very important, and on which so far we have designed a lot of different support mechanism program, being on regulatory, of course, very important. And of course, for that, as the EU, with our EU member states, we have some expertise in this area, so really trying also to partner to get a partnership with AMA and the EMEA, so really to build the AMA, the African Medicine Agency, to support also the national regulator and so on. We have 5 key countries of focus in MAF+. So in these 5 countries, we really have our delegation working hands with the regulatory national authority to really support whenever they can. So that's, for example, on the regulatory side, but all the ecosystem include, of course, and we heard before, the skills element, how we can support the research element, and everything that is around really the ecosystem to allow for the investment. So kind of these 3 areas we've been active, and we'll continue to be.
Well, that's fantastic, and especially good news for our African partners who are in the room. So the key countries, you said there was 5 key countries. Are there any from the program? Are any of our program partners in your key countries?
The 5 key countries you want. So it's Nigeria, Ghana, Senegal, South Africa, and Rwanda.
Okay, thank you. So no, it's great, and it's exactly what we need. Over to you.
Thank you. Yes, I think for this part, transitioning from what has been, I think, a very interesting response there, moving to Olivier Giran from HERA. So I'm aware at least that HERA was one of the founding partner of the WHO's previous initiative called the CTAP, which aimed mainly at ensuring access to COVID-19 technologies, which included mRNA technologies in LMIC countries. So now, still thanks obviously to funding from HERA, that very project still includes, under the HTAP umbrella, the mRNA Technology Transfer Program. So maybe to you, could you please kindly let us know how HERA views the importance of ensuring global access to these types of technologies and the role of European industry in trying to support partnerships, and if HERA has any other mechanisms that could finance or promote the development of such technologies?
Zakaria and Jelis, thank you very much for welcoming me today. Pleased that the Commission can attend this conference, this very important conference, being able to demonstrate its commitment to the, of course, partnership with actors on the ground. As very well explained by my colleague Cécile, and also which I'm going to try to present you the work that HERA is doing in partnership with industry. So obviously, HERA is a young institution. We have already been around for a little bit more than 3 years. And since the outset, clearly, we have decided to develop a very close partnership with industry, because basically, if we want to be well prepared for the next health threat, we need to innovate, we need to develop the tools, the instruments which will help us to be able to tackle challenges which are not the challenges of yesterday, but the challenges of tomorrow. So innovation is at the heart of our work, but also the need to have a very operational interaction with industry. That's why we are so much keen to develop partnership with industry. And of course, this is why for us it makes a lot of sense to support first of all, the CTAP program of the WHO, but now, of course, even better, the HTAP development, which now includes indeed the mRNA transfer technology program. For us, it makes a lot of sense. And it follows also the evolution of our work, because indeed, we were set up as a response against the COVID-19 pandemic. And clearly now, this has been something like a pilot. This has been an experience which has allowed us to test and develop new instruments. But clearly the priority now, of course, is to extend those instruments, those tools to new areas, new sectors, new threats. We are focusing on 3 types of threats, which I believe are very relevant today. The first one being a virus of pandemic dimension. The other one being virus transmitted by vector-borne agents. And we are also very much focusing on AMR. We believe those 3 sets of threats are very relevant today. And we also believe that to fight those threats, medical countermeasures are a strategic asset, and a strategic asset that needs to be supported and nurtured, because by definition, we are talking about area where the market is not able to support the development of medical countermeasures. They need to be public intervention, there needs to be public support. And also, in a constrained environment, it is very important that we work together. So this is why, we are not as good as INPA for partnership, but we're trying hard. And so we are very happy at this point in time to already have very strong link with the WHO, with Africa CDC, but also, and that's interesting, our sister agencies, which are now being developed more and more in other countries like Japan, like Korea, like Canada. So this is why we want to deepen those interactions. And clearly, the international dimension is, I would say, in our DNA. So we have a roadmap for the next 5 years, which corresponds to this new commission, which is our MCM strategy. And we believe that a number of new instruments that will be developed thanks to this strategy will benefit innovation, will benefit technology transfer. We have already in place a vaccine hub with partners, research partners in numerous countries of Europe, which are also very active in a number of countries covered by the HTAP program. And the idea is really to nurture the development of vaccines which are currently not supported by the market in an end-to-end way. Because, of course, the particularity of ERA is that we can do this work end-to-end from early research, which we are funding through our various programs such as EU for Health, up until manufacturing and procurement. We are able to provide support to the industry end-to-end in this context. And I think that's really a specificity when it comes to the European Commission, which likes to work in different pillars. We're trying to bring the pillars together so that indeed MCM are able to be supported end-to-end. And one of our objectives with this strategy is actually to extend what we are already doing with vaccines also to therapeutics and to diagnostics. We believe it is very, very important. The good news is that this expansion is funded up until 2027. So we have the possibility to support those new tools financially. Of course, after 27, there is a new debate, there is a new financial perspective. So we need your support, we need your help to secure adequate funding inside the EU budget. I think that the EU was able to step up its game as a result of COVID-19 when it comes to partnership with organizations like many of the organizations here today around the table. This needs to continue. This needs to be strengthened. And of course, that will be the big challenge for us. But at least we have the tools, we have the instrument, we have demonstrated that we could deliver. I think that's a very important message together with our colleagues from INPA. But of course, it's a battle that is continuing and where we really need the support from all the organizations around this table. We have developed also a specific financial instrument because you were mentioning ways of supporting companies, especially emerging companies, because we are in favor of competition in the Commission. We are in favor of new players, new actors, and this is why, in particular, we have teamed up with the European Bank for Investment, the EIB in Luxembourg, to develop financial instruments to support SMEs, covering up to 50% of the project cost, 200 million euros. And this has already led to support to companies which are supporting new ways of inoculating vaccines through nasal sprays, for instance, but also companies who are relying on new technologies to support AMR. So we believe that this type of instruments are also very important, dedicated instruments for ecosystem, for the development of the ecosystem. The MCM ecosystem are very important. We need expertise, we need the ability to support companies in this very specific field. So I suppose I'm happy to see that this is what HTAP is doing, and that is also what we are planning to do for the coming years. Because we believe, again, that if we are to be well equipped ahead of the next crisis, we need to partner with industry, and also we need to partner with our international organizations, which we have been working so far, but there is much more to be done still. So yeah, that will be my response, but of course, happy to discuss further. Thank you.
Thank you. Thank you so much for that very elaborate response. And I think picking from one of the things you've mentioned on the, I guess, 3 areas where you put a lot of the focus on, transmissions that are vector-borne on mRNA platforms, and also, I think, of particular interest, viruses of pandemic potential. I think that is definitely something that this program should also critically interrogate and analyze and plan towards working, because these facilities in these LMIC regions are good if they can contribute to the response in the next pandemic. And if we're talking about pandemics, we're definitely looking at pathogens which have this pandemic potential. So thank you so much, Monsieur Olivier. I'll pass it to Gilles.
So we heard how IMPTA supports Africa in production, demand, and the ecosystem. And now we've heard from Hera, who is looking at the emergency side and threats. And so now let's turn to Test Math Plus. And maybe you could just even start a little bit before we get to your question, explaining a little bit what your role is in this European ecosystem of support.
Yes, thank you, colleagues. Thank you, colleagues, for the invitation for this panel. Yes, I'm here in representation for the Team Europe support structure TestMap Plus. The TestMap Plus is, let's say, a secretariat of the Team Europe Initiative MAP Plus that offers support to this initiative, as Cecile mentioned recently, and also Martin said early in the morning. So let's say our support is based on the coordination, also technical expertise, and yes, a coordination about partners and how to engage with particularly the African stakeholders. For instance, TestMap Plus supports strongly Africa CDC through embedded experts and also the African Medicines Agency.
Thank you. So now I'll actually ask you your question that we prepared together. Based on your work supporting manufacturers, what are the biggest remaining bottlenecks to achieve GMP certified commercial production? And how can technical partners and funders like MAV Plus work together to address them?
Thank you, Chalice, for that question. I think today we've heard some of our colleagues, manufacturers, that mentioned some of this. So I will try a little bit to summarize and maybe to categorize this a little bit. Because yes, we are still having remaining challenges that span from regulatory aspects till skills and workforce development. But let's say that if we have to start for a critical aspect, as also colleagues from MPP I can mention, is their regulatory knowledge and familiarity. This is something that is still a challenge for manufacturers, and that, for instance, there is not that clear, let's say, alignment from the onset. Let's say this collaboration that is needed to be in place. For instance, manufacturers working closely with NRAs. We've heard earlier today the successful case of SAFRA supporting Afrigen, Biovac. That's wonderful, but this is not common, so we need to see more of this. As a second barrier, let's say we can mention also the facility qualification. This is an aspect that, in general, it has an over-reliance of external, let's say, contributors, partners, and definitely if we think about regionalization, localization of manufacturing, this has to be embedded in situ. Manufacturers have to have this expertise in-house. This is something that we don't see, and we can highlight it as a barrier still. Coming to a third point, workforce development, skills development, not only, getting the skills for these highly valuable people that are going to be doing the processes, using machines, but also a challenge on how to retain, because these people are, having better offers in other countries and regions of the world. So yes, there's still a challenge on how to have these strategies for retention of skilled personnel. Coming back more, let's say, on a more technical aspect, quality management system and GMP compliance is still an issue, and in general, but in particularly for let's say newcomers in the field. And lastly, I want to mention also the side on the quality control laboratories. Yes, we mentioned about having these analytical methods, transfer, and all that. It's a challenge. People that have worked in the lab, it's not just copy and paste. So this is a whole process. But I mean, there's also need to have into consideration the fact that new methods, for instance, alternative use of animal methods can be put in place, and how to also embed this in quality by design strategies. Thank you.
Thank you, Leo. I think it's pretty impressive, actually, the way the three organizations, you work together in providing absolutely incredible support and looking for those gaps where you can help bring people together and foster collaboration. So, so I think for a program like this one, exactly what is needed. Over to you, Zachary.
Thank you, Gilles. So I think maybe it's time to also shift our attention towards the regions that actually do stand to significantly benefit from this program and the objective around which this program was actually created. So I have the honor of calling upon Case Ndembi from the International Vaccine Institute, Africa Regional Office. So can I, okay, I can see Nikes is online.
Yeah, I'm here.
Oh,
please. Thank
perfect.
you.
Perfect. Yeah, so Nikes, for you, I would just maybe like to get your response on two questions. The first one is, how do you see the role of regional research and development and clinical trial capacity evolving, specifically to support the approval of mRNA products developed in Africa? And what would a truly African-led regulatory and development ecosystem look like by 2030? I guess that's one that supports industrial scale-up and pandemic response readiness.
No, thanks so much. Let me start by first commending Prof. Petro Terre-Blanche and the entire team at MPP WHO, because I'd witnessed firsthand how this was really a co-creation, collaboration, really around building capability, around multilateral technology sharing model. I think really I commend the team. The progress have been made. I think it's a great really development. But again, we all agree we never let a crisis go to waste. I think that has been the lesson, capitalizing on what we've learned from the COVID-19 pandemic. I think this is a great example that we should be using. So back to your question, I think there are two segments there. I look at R&D and I look at the regulatory systems. I think this is a very important component or enablers of the manufacturing ecosystem. I think from the regional perspective, and this is important, I think this is the conversation, if we really want to move this forward with all the great work that has been done, really riding on it and leveraging on the expertise and the network that has been built, partnership, I think it's important that we start really going back a little bit on the drawing board and looking at how do we build pipelines of priority pathogens vaccine candidate for this continent. Very important. It's a very important point. That's where the conversation will be landing anytime soon. If you look at the 10 approved mRNA vaccine worldwide, 9 immunogens COVID-19, 1 RSV. I think this is good. This is remarkable. But how do we fit into the priority diseases that this continent or the African continent we were battling with? I like pretty much the comment from CEPI. We need to watch what's happening from the surveillance side to be able to build research and be able also to manufacture. So that's very important. That R&D team within the manufacturing facility should be looking at those AP data. We're dealing with 22 pathogens of public health relevance across the continent. There could be more. How do we really make use of this very important technology? That's very important, number one. If you want to scale mRNA, we all agree that's the way to go. We need to strengthen infrastructure. This is important. Across the continent, it's still very fragmented for research and development, preclinical. I can tell you less than 5 animal facilities across the continent. That's not enough to reach the 60% by 2040. I think investment into preclinical, clinical research, it's extremely important. I think those are my first point here. But again, we build this around really strong partnerships. And this is a very really use case, a case study where when we put really the effort, the resources, the right partnership to get things done. I think this is important. But now, I think we can only make this really R&D ecosystem, a robust R&D ecosystem, back to your question, is if we really have a business model. And this is what I've been advocating for a couple of months now. The African continent, we cannot heavily rely on donors' funding. And this is happening. We've seen the funding landscape has changed. We need to push. I've heard that also from Latin America, one of the colleagues of manufacturers. We need to start pushing our government, really encouraging them to invest into R&D. As we stand, the global really figure at about average is 2.2 of the GDP on R&D. The continent is still at less than 0.5%. The African Union is advocating to move that at 1%. We can only do that if our member state and government can put in resources to support this initiative that's really successful. There's already a proof of concept. I think we're not inventing anything. It's just to get the resources to keep the things moving and probably expand to other pathogens. I think this is really setting the scene to that, because if we don't have it done, R&D is not a cheap business. We need to put in resources. It's very important for health security. It's very important for the lessons that we have learned in terms of access, equity during COVID-19. So it's the time really that we build our R&D ecosystem. Now, the second component, which is linked to R&D, tech transfer, IP, is really the regulatory system. I think we all agree. I think my really good statement that I can bring there is from the current AMA Director General. One submission, one assessment, multiple market. It speaks volume. I think if we are fragmented still from the regulatory front, it makes it difficult to have access to the global market. I think these products, they aim to be actually been procured globally. We don't want African solution to African problem. No, African solution to global problem. And then we think globally and act locally like Afrigen has demonstrated through the couple of years. I think from my perspective, if I can summarize really, is that the mRNA-based vaccines for infectious diseases shouldn't be limited to those that we know currently. How do we bring that by government putting in resources, allocating resources to support R&D, and then now invest into those diseases of public relevance for this continent, African-led really research, be ensuring that those pathogens we actually been able to really get the science moving. Research, science, and innovation will require those funding. So again, the regulatory system, AMA is there. We think now we can move forward, being able to bridge that gap, and then research really reliance, regulatory harmonization, convergence, if you want to say it that way, will definitely help the continent moving forward. So thanks so much, and back to you.
Thank you. Thank you so much, Anikase. And I think the point you raise on trying to move the local governments or the governments in where these facilities are to also invest in these facilities. I think that point is very strong, and local investment, as we know, leads to local ownership, and ownership is critical to sustainability for these programs. So that's a very good point. And the other point you raised there is on, I think you mentioned 22 different pathogens. I think for these facilities, we should also definitely be talking about pathogen mapping, because if we have so many facilities and so many pathogens, it makes sense that we should be really thinking which facility can handle which pathogen. So at one, we reduce the duplicity of work, but at the same time, we maximize the market potential for these products that are being developed. And with that, question on the development and the pathogens, my second question, if I may, briefly, how can institutions like IVI support the manufacturers in this program to go beyond into new product development so that they can eventually bring their own mRNA products to approval?
No, that's a very important question, that end-to-end capability. I think, as I've said earlier, they are really, they're here and there, dispersed across the continent. And it's important that we build that network. I think Afrigen and the MPP WHO, excellent job by bringing globally even partners. I think we really at a regional level, at continental level, connect the dot. How the likes of the MRC, UVRI, the likes of the MRC Gambia, the likes of Vaxera and so on, BioVac in South Africa, SAMRC, all those really flagship institutions can come together and leverage on their competitive advantages to really build that network ecosystem across the continent. So that's number one in that building network partnerships among really Africans. That's to really have homegrown solutions to local manufacturing. So now the second IVI, I think we have already engaging with several member states. That's why we have a regional office here out of Kigali, where the Secretariat is based to support our African member state to achieve that ambitious target that 60% by 2040. I still believe it's really that target. We need to build each of those components across the ecosystem, really be sure that we get to that target, to achieve that target. So IVI, you might know already, it's a co-creation process. And one of those good examples that we have usually, it's the partnership with Afrigen around Rift Valley fever vaccines, mRNA vaccines. That's a true partnership where we co-develop, we co-create, and the teams working together to be sure that there's a transfer of knowledge across both from Afrigen to IVI, IVI to Afrigen, so in a very respectful, oriented manner. And the same that also with BioVac on the cholera vaccine tech transfer. Those are examples that we really are pushing forward to be sure we build end-to-end capability with very good example. I think really that's important. This is a continent where there's recurrence and occurrence of outbreaks of cholera in 21 member states, the stock out of global shortage of cholera vaccines, and we don't have a manufacturer on the continent. I think building that end-to-end capability, bringing that technology home, like what you're doing with Afrigen, is excellent. That's remarkable. It's really public health in action. I'm going to leave you with one word that we're pushing is collaboration. We don't just need to collaborate, we need to act on to be sure that there are tangible results moving forward. So IVI also, we didn't hear much about that. In addition to the surveillance that the CEPI component, the CEPI collaborator mentioned, the government investment that we're pushing through the different mechanisms. The AU has several mechanisms. Africa Union 2063, Abuja Declaration, Lusaka Agenda, now Accra Reset. No, really, we need to get things done. We need action to be sure that we put money where our mouth is. We need really health system resilience, self-sufficiency. This cannot come at a cost from donors. It has to be funded from our own budget across the continent. So IVI as well, we're pushing towards mobile or modular, because not all member states can build the same facility we have at Afrigen. That's a stellar, state-of-the-art facility. At least some that are aspiring, because we had a laundry list of countries willing to manufacture. The modular approach that Rwanda is adopting with the bounteners, IVI also, we are now we're actually close to finalizing a modular that can be deployed. And then 1 million doses is still really being optimized per year in case of pandemic preparedness, preventions, and response. So those are the front that we are contributing, bringing really technology to the continent, and be sure that we move the agenda forward. Thank you.
Perfect. Thank you. Thank you so much for that response. And I think without spending more time on this, we'll be moving to the third pillar. But just before that, just to mention that I think as we transition to the third pillar, the second pillar really does focus on capacity strengthening objectives, specifically trying to focus on ensuring that there's completion of the mRNA platform, and then the sustainability aspect of it comes into the conversation. And this requires that there is, a business case that enables true industrial scale-up, building skilled workforce, and leveraging these shared partnerships as well as assets, and also testing these facilities for pandemic response systems. So I think that is how the second pillar should function and will function. And I'll move to Gilles to take us to the third pillar.
So program integration, and probably in that one we're going to need a lot of collaboration. So my new word for the day. Of course, with that collaboration, partnership, and action, we are looking to create an environment in this pillar where the program partners will be self-sufficient and able to develop and market their products out there on their own, which is, of course, the goal in the end that we have in 2030 for this to happen. So, of course, we can imagine now a product is available and there on the market. And I'm going to turn to Yalda Momeni online, so she's here with us from Gavi. And I'm going to pose my question to you, which is, what role can Gavi play in ensuring that mRNA products manufactured by the program partners are eligible and accessible through global procurement mechanisms, especially, of course, once phase 2 leads to approved products, as I mentioned? Yalda, over to you.
Thank you very much, and good afternoon to all. And thank you for inviting us to this important event, and also for convening such an important and timely discussion on innovation and access, even in today's challenging financial environment for global health. I think it's essential that we continue pushing for innovative and forward-looking and strategic investments, and mRNA is definitely on top of that list. I think it's really good discussion and conversation and the flow of partner organization. Gavi is a part of this ecosystem, is part of this puzzle. Gavi, as you all know, is a downstream mechanism that enables access to a portfolio of vaccines that is approved through its vaccine investment strategy and the board. And any vaccine that is built on an mRNA platform would be a valuable addition to Gavi's portfolio. It's especially the potential of the platform in terms of scalability and ability to respond to outbreak and pandemic. It's definitely a high value. And recognizing this, as you very well know, we allocated the highest level of incentive within the African Vaccine Manufacturer Accelerator, the AFMA, for any vaccine that is manufactured on mRNA and viral vector, the two pandemic platforms, which have been identified by CEPI as the most suitable technologies for response to outbreak and pandemics. This is incentives are strategic signal that really enables tech transfers, enables incentivize investments. It's considered de-risking investments because it kind of guarantees the interest and market. It promotes tech transfer to Africa and supports market shaping for these vaccines. It also complements the WHO-led mRNA program, which, along with AFMA and our broader market shaping work, aims to build regional capacity for mRNA vaccine production in Africa and strengthens the broader ecosystem needed to ensure equitable access. It also supports long-term sustainability. I think, as colleagues already mentioned, it's not just pandemic platform or pandemic preparedness. It really enhances and enables self-reliance and sustainability. And yeah, like I said, it's a really important platform and addition to our portfolio that we're very much looking forward to see. I'm going to stop here.
Thank you, and that's exciting for us too, to know that that we can, in time, partner with you. Certainly, we are talking already with you, so we're looking forward to having the products there. Over to you, Zach.
Thank you, Yeliz. So at this point, turning my attention to Mina Lewis from Africa CDC, and I think this is a critical point in this conversation. I think we need to understand how Africa CDC, can support the workforce development, the regulatory harmonization, and the cross-country collaboration or collaboration, as we've just heard, to ensure that the mRNA program is embedded in Africa's broader pandemic preparedness and vaccine sovereignty agenda? Luis?
Okay, thank you, Zakaria and Gilles. And first of all, thank you for the MPP and WHO for inviting Africa CDC, and apologies for not being able to make it in person this time. And regarding your question, Africa CDC is advancing several bold programs that directly contribute to embedding the mRNA program within Africa's broader agenda for pandemic preparedness and vaccine sovereignty. So first, we are working on workforce development bold programs. So Africa CDC has established 4 regional capability and capacity networks, RCCN. The main objective of these RCCN is to create a strong and sustainable skilled professionals across the continent. The centers here serve as regional hubs for training, mentorship, and technical exchange. So ensuring that Africa builds not only manufacturing facilities, but we are also building the skilled human capital required to operate these facilities efficiently and competitively. Second, regulatory strengthening and harmonization. We are aware about the importance of regulatory strengthening, and without strengthened regulatory authorities, technology transfer will not succeed. So we are working with our partner organizations like the ODA-NIPAD through the AMRH program, and we are advancing and strengthening national regulatory authorities in the continent. We are proud that currently we have 9 national regulatory authorities in Africa have achieved maturity level 3. And importantly, 4 of these 9 national regulatory authorities are in countries hosting mRNA partners, like South Africa, Senegal, Egypt, and Nigeria. Third, we are also working on technology transfer. And going back to the regulatory strengthening, we are not working only on the regulatory strengthening. We are aware about the regulatory harmonization and the importance of regulatory harmonization for facilitating the cross-border trade between African manufacturers. We started these efforts a few years ago, and these efforts have been progressed during the Vaccine Manufacturing Forum in February, and it has been completed in the during the Africa Health Expo in June, during which the 8 national regulatory authorities in Africa signed MOU for regulatory reliance. So again, the importance of regulatory harmonization and regulatory strengthening to accelerate the product approval and facilitate cross-border trade. Third, we are currently working on technology transfer board program. We are facilitating partnerships between African manufacturers and global technology providers, and between African manufacturers themselves. So we are working intra and inter-country country collaboration. With support of GIZ and Team Europe, we are facilitating these partnerships in order to strengthen regional value chains and reduce dependency on imports. In support of this, we are finalizing the technology transfer handbook for vaccines. It would be the first of kind handbook or guide specific for vaccines. This handbook would be published soon, and it is designed to serve as a practical guide for the African manufacturers and national regulatory authorities, helping to streamline and standardize the technology transfer process across the countries. Thank you, and over to the moderators.
Thank you so much, Amina, for that response. And I know that we also have Masoka Fala in the room, and maybe I'm just curious to get Masoka's opinion, because I think sometimes Africa CDC is viewed more as a monitoring body as opposed to a supporting body. So especially in the research and development, clinical trials landscape. So maybe, Masoka, to what extent do you think that it is possible that Africa CDC can integrate into these facilities, or the facilities can integrate into Africa CDC's framework of work, so that it operates more as a collaboration as opposed to oversight, in the manner of speaking?
Thank you so much, Zach.
the fundamental issue I've found in the area of R&D for the continent is not a lack of some capacity, it's the absence of identifying the capacities and allowing them to work together. Because we do know over the last 20, 30 years, there have been huge investment in terms of HIV, malaria. There are a lot of projects that have been invested in Africa. And so those systems and people in places have been trained. But what has been lacking is the way to bring them to talk together. I'm on my way to South Africa tomorrow from here, where we are bringing together around 70 African scientists from the universities. Well, we quickly found out that in the preclinical, discovery science to preclinical space, there are centers in Africa that have model to do in vitro trials. There are centers that are able to do in vivo trials. So when we identify a molecule that can be moved through the preclinical system, PD, PK, but they've never spoken to each other. So what we've done at Africa CDC have been to map out, first of all, what resources exist on the continent. Secondly, what expertise exists on the continent. We'll be paying a visit to NICD in South Africa, where they have the BSF full lab and a model to do mpox research. A viral model already exists. But other scientists have the molecule. So the first thing has been, as Africa CDC, to bring together the scientists, map their resources, and then have this unique model we are developing along with CEPI called the hub and spoke model. We know that there are variations in the capacities, but that there are some of them that have huge investment. So we look across the whole spectrum, from preclinical all the way to phase 1, phase 3 trial. And those ones are going to be invested as a central hub, and they can support that. So that's one of the major things we are doing, and then building the value chain. Secondly, building the capacity like mRNA. The most important message is how do we take a technology that is not only dependent on a disease or outbreak, but that deals with routine diseases. So essentially, with all of the investment, one of the mistakes we have done with FONO is that we've gone in silo investment across the continent, but it's time to bring them together to empower a value chain and ecosystem. And that's the most important thing Africa CDC is now doing. Thank you very much.
Thank you. That's very good, and that's very good. But I think already from what we're hearing, bringing 70 scientists into one, providing that capacity, I think definitely does integrate and contribute to the ultimate growth of the mRNA Tech Transfer Program. And as we wrap up this session, maybe just 30 seconds or less to each of our panelists, our speakers for this session. Elise, you want to ask the question?
Absolutely. So let's get some more collaboration going. So looking ahead to 2030, what is the one action or commitment your institution can take to help this program deliver on its goals? So we're going to go in turn, so really, really quickly. So first of all, I'm going to start with you, Cecile from INPA. What commitment, in a sentence, might you be able to bring to this program?
Maybe just, because a lot has been said already, just on the demand side, because I don't think there's been a lot of focus on that. And I think this is part of the puzzle. Yalda was mentioning this big puzzle. On the demand side, I think this is an area where we have to continue pushing. Both, of course, it has to come from the African government, pulling themselves together. We are supporting the Africa CDC with the pooled procurement mechanism. We have to send the right signal. It was really promising when we had the summit with Gavi in June that UNICEF committed to buy 20%. We are also, I was mentioning Human Development Accelerator, and last week we signed one of the first transactions with MedAccess, a volume guarantee. So using also the DFI, so EIB and other DFIs, to really de-risk and give this volume guarantee to products on the market so that they have the demand side. And I think among the things we are doing, I think we would need to look also on the demand side and see how we can put that further into the picture.
Same question to you, Olivier, Fahera.
So as far as ERA is concerned, I would mention, I would say, 3 ways of supporting HTAP. So the first one, of course, is to continue our commitment to the development and the deepening of the program financially and also through our human resources. The second one would be to also associate the program to the putting into place of our new hubs for the development of diagnostics and therapeutics in addition to vaccine. I think that there are obvious synergies here, and it makes a lot of sense to ensure interaction and compatibility between the two programs. And then, of course, as mentioned, as we will deepen and structure our partnership with industry to enable HTAP to continue to benefit from our privileged relationship with a number of new players, of innovative companies moving forward. So if we deliver on the three, I hope you will be happy, but I will be happy. Thank you.
Wonderful. And Leo has left us, so I'm going to turn to his colleague, Umi Diaby, also from TESMA Plus, to answer that question too.
Yes, following what was said by the European Commission representative, but also other panelists, I'll try to answer your question quite quickly. But as Cécile mentioned, MAFLUS is also through this 360-degree approach to the global gateway with this dimension on supply, but also on enabling environment. And enabling environment integrate also the capacity building, so the pillar 2 of the program. And we heard this morning about other initiatives, the WHO Academy, but also initiative from other member states. And I think this is key as technology transfer need to be built also on capacity strengthening to promote technology transfer as a driver for R&D and innovation, but also to support technology transfer alongside knowledge sharing, to be sure that whenever we will perform this technology transfer, we will do it in an integrated, holistic approach, and use that part on capacity building as a cornerstone for technology transfer processes.
Thank you,
very
Umi.
much.
And now I turn to Nikes. Are you still with us online? He's got low bandwidth, which is why he can't put the camera on. Nikes, are you still with us?
I'm with you. I'm with you. Yeah, I want to start with an African proverb. If you want to go fast, go alone. If you want to go far, go together. I think Afrigen has demonstrated that you can go fast and go together. And that's the model actually we should be copying. So number one, I think this is what we as IVI can contribute. Number one, workforce development is important. I think we need to train more people, young scientists, to embrace research, science, and innovation. And the mRNA technology is probably the way to go. I think it's versatile. We can definitely use that for other diseases. Number two, the robust R&D ecosystem, support manufacturers, and at least 2 mRNA products and 1 biologic to contribute to this really very good concept. And then we're looking forward when we, in the 2.0, when we present again our achievement, we really want to collaborate. So action should be the part that we all looked at. I think it's not time to do too much talk. I think we need to walk the talk. We're already almost 5 years in the post-COVID. I think it's time now to start really presenting data. I think this is what the continent needs. Thank you so much, and then thank you so much for the invitation and for the excellent session.
Thank you, Nikes. And online, Mina?
Yes.
The same question to you. What commitment could, do you have any final remarks?
Okay, so our commitment from Africa CDC perspective is to institutionalize the platform for harmonized African manufacturing FAM as a continental coordination mechanism for technology transfer and capacity building. So we will be working through operationalizing a continental mRNA workforce and regulatory roadmap, ensuring that every manufacturer can access skilled and trained workforce development, streamlined regulatory support, and launching the Africa Vaccine Technology Transfer Handbook to guide both national regulatory authorities and African manufacturers, helping streamlining and standardizing the technology transfer process across the continent, and finally establish a Pan-African partnership framework that link the regulatory authorities, the universities, academic institutions, financing and funding organizations together so that facilitate partnerships and technology transfer. And our main goal by 2030, we are aiming that Africa not only receives the technology, but shares the technology as well, and contributing to innovations and manufacturing capacity to the global health ecosystem. Thank you.
Thank you, Minna. And finally, Yalda from Gavi.
Yes. Yeah, I mean, we very much deep into gearing up for 6.0 and recalibration. As part of that, we're also assessing to see how the African vaccine manufacturers market and landscape will be affected, and try to ensure that AFMA is adjusted and there and continues to remain and maintain its relevance. AFMA, as part of its governance, has a course correction mechanism. We are reviewing to prepare and see what we can do. One of the things that we are considering to propose, put on the table, go through the process of consultation, is support to the regulatory as part of the ecosystem. I'm thinking out loud. It's not, obviously we have to go through consultation and processes and have all the required approval, but the more we look at all our initial projection and the landscape that we had from African manufacturers, and 1 year into the initiative, when we look back, the biggest headwind is regulatory. That's the biggest roadblock for manufacturers, and we're trying to, together with our core alliance partner WHO, see what can be done to support that area and kind of be ready when the mRNA vaccine gets there.
Thank you, Yalda. Well, thank you all for your participation. I think we are very honoured as a programme to have your support as we move forward. All the programme partners, of course, have been listening, and another call out maybe for Afrogen and all the work they have done, because they really have shown us the way in this programme, and with the technology transfer that they've been doing to partners, moving them through those pillars is what we aim to do now, and having your support there is instrumental to that. I will hand back now the moderation to Zachary.
Thank you once again, Angelis, and to all our speakers for this conversation. And we are at the close of, or approaching the close of the program for today. I think it has been quite a day. It has been quite a day. I didn't realize how quickly a 9 to 5 can disappear. But I think it also speaks volumes in terms of the quality of the conversations that have been had, the depth of commitment that have been expressed, and obviously the importance of the subject that we have been discussing. And especially as that remains the case for billions of people who quite literally, this could be the difference between having a lifeline or not. I think this conversation has, in many respects, shed light on that particular frame of logic. And as we come to this part of the program, I will be inviting a few from the audience to give final reflections and statements, and I'll be calling them one by one, and then we'll be able to close and think about dinner. For now, and first, I wish to call upon Manuel Batz from GIZ, Germany, to give the reflections for the day.
Yeah, so, yeah, thank you. I mean, it has been a full day, and I will be very brief, just perhaps share what my key takeaways are of this day today. So first, thanks to MPP WHO for convening this meeting. It's disappeared, okay. And 120 million, you said, you invested over the last years. backup from my project was there from the beginning as well. And I think you did a great job. You prepared the ground for a pandemic preparedness asset base. You did it. You did, in effect, do a capacity building activity for cutting-edge high-tech technology. You did it. You transferred this technology into other countries that otherwise would have taken much more time. And we heard it from the companies. And I think that's something that's to be proud of. It's really already a big achievement. And to the private sector companies, I'm really impressed. You take this technology, you get co-investments from your governments, you invest your own money even, and that's a good sign, because then you will find businesses outside perhaps even of the donor-funded markets. Yeah, so I see there a lot of opportunities. And then, yeah, my big question, and this was not discussed so clearly in my view, a development of a vaccine or of a product costs a lot of money. Yeah, the 17 million per year that you are asking for will not cover that. Clearly, it's to continue with your valuable work, and this is something that, yeah, it needs to be addressed. And what I would suggest is to have a conversation with the donors and stakeholders about the pipeline. And this is, you mentioned the pillar 1, but then decisions have to be taken. Which vaccines, which candidates, which routine vaccines, which NTDs, which new therapies should be then funded by the community, by different stakeholders. And I think this would be a very valuable next step. Yeah, thank you.
Thank you so much, Manuel, for those words. And I think Charles has taken note of the point on the 17 million and what that could look like in terms of actually getting the pipeline of the vaccine production. As you said, is quite a costly undertaking, and you're correct. I'll put that on Charles' to-do list for conversing with you. I think before we give Charles the chance to respond, I guess, as he gives his final reflections, I would also like to call upon Haitham Onush, Norrad from Norway.
Thank you for that. I'm happy I'm coming before Charles, not after Charles, so that's good. Indeed, this is a big milestone for the mRNA technology transfer program. And so thanks for the Belgian government for hosting us in this occasion. And thanks for our technical partners, the Medicine Patent Pool, World Health Organization, for translating the vision of equitable access through local manufacturing into action, progress, and results. And a note on that, because we were hearing about the importance of moving from dependency to resilience, I was looking at the brochure. So I came to the page that shows the disease targets by region, this one. For me, this is how moving from dependency to resilience looks like. So thank you for where we are today. And it's not a secret that we are in Norway, we are aligned with the vision of the equitable access. It has been the leading star for us when we co-chair the ACTE, the Access for COVID Technology Accelerator, and still it is a driving force for our global health efforts. And if we remember, coming out of the pandemic, local or regional manufacturing focusing on emerging health technologies has become a major strategy for ensuring equitable access. So this program, the mRNA Hub, embodies this perfectly. The program as well is a great example for what we can achieve with the ecosystem approach to local manufacturing. And we heard a lot about how this can unfold today, so I will not go into the details. And again, we are in a pivotal moment in global health. The current
development assistance environment is challenging, and innovation is still maybe the way to go. And some are even saying it is the future of global health. We can debate that. But we cannot ignore a simple fact, which is innovation has been playing an important role in global health and will play the same role going forward. So, for this program, as it is shaping 2.0, let us be inspired with the lessons we learned during the pandemic. So politically and diplomatically, the pandemic demonstrated the importance of a collective preparedness, collective action, far beyond traditional aid. With a rapid mobilization of resources underpinned by a strong foundation of multilateralism. Technically, it is possible to enhance preparedness through addressing today's challenges, today's technical gaps, and today's structural barriers. So let us work together to go far. Thank you.
Thank you so much for that. And without further ado, I will be calling upon Claudia Nanye, and I think Claudia will speak, and then we'll also hand the mic to Oksana. Yes.
Absolutely, and let me do some formal thanks to the Government of Belgium for hosting us in this beautiful palace. I was telling a colleague, I felt like a princess this morning coming in this palace. Really, I want to focus on the partnership and collaboration or collaboration. Really, we have seen today from the achievements in phase 1 to this initial vision for phase 2.0 that this program is really a collective demonstration of what partnership can achieve when is anchored in trust, shared vision, global efforts, and local ownership. And so the mRNA program has from the very beginning been a story of collaboration between WHO and the medicine patent pool, between governments and scientists, between funders and manufacturers, but also between regional institutions and researchers. And this partnership model, I feel it has broken traditional silos and set this a new precedent for how WHO works, relying on partners who are closer to the ground, more agile, more lean, and able to scale up rapidly when global health needs demand it. And today, it's a bit the elephant in the room. I mean, WHO faces an unprecedented period of financial constraints and organizational restructuring. So this approach of partnering up, it's not only desirable, but it becomes really essential for us. And the future of global health depends on these new forms of cooperation, where WHO acts as a convener, a standard setter, as the organization accountable to its member states, while implementation increasingly relies on trusted partners with complementary expertise and comparative advantage. So this program has shown that this model works, deliver impact faster, more efficiently, and with also hopefully greater sustainability. That is what we are trying to build in the second phase. And it has also redefined multilateralism, and this has come up this morning with the introduction from several colleagues. It's proving that innovation can be shared, that capacity can be built everywhere, and that equity can be designed into the system since its inception. And this vision of equity is really what underpins this model, a model where you heard responsibility is shared, contributions are mutual, and benefits are indeed collective. And it's not a one-way model of support. This has gone beyond the donor-recipient relationship. It's a shared enterprise in which every partner contributes scientifically, financially, politically, technically, and every partner also benefits. And it reflects really a genuine balance of responsibilities and rewards where solidarity is expressed through shared efforts and mutual accountability. So the challenge now is to ensure that this model endures beyond the lifespan of any single project or funding cycle. And obviously, WHO remains fully committed to this partnership across its three levels of the organization, working with all of you to make this vision really a lasting reality. And because one of the strengths of WHO is indeed this three-level presence in the world, I leave the floor to my colleague Oksana for her own final remarks.
Yes, thank you, Claudia, and thank you for giving me the floor. I was not in the program, but really wish to say a few words. So, Excellencies, distinguished partners and colleagues, as we approach the end of the first day of our fruitful meeting, as WHO representative to the European Union, I also want to express my heartfelt gratitude for the diverse and insightful perspective you have shared today. Your motivation and unwavering commitment to foster a healthy and more resilient and equitable world is really truly inspiring. I clearly recall the excitement during the high-level launch of this initiative 4 years ago here in Brussels in the margin of EU Africa Union Summit, alongside several leaders on the stage from France, Belgium, European Commission President, President of the Council, European Council, several African leaders, also my boss, Dr. Tedros. While there was some uncertainty surrounding this initiative, then it's so gratifying to witness the remarkable progress you have all achieved as participants of the program, as partners, as donors, and supporters of this program. And one key message that emerged from today's discussion, for me it's clear, the mRNA technology transfer program is fulfilling its promising of building scientific and manufacturing capacity in so many parts of the world. And for this significant achievement, all participants, participating partners and donors deserve a big applause. And I hope the leaders, our leaders, next month for the next EU Africa Union Summit will recognize, this program is something, progress is something really to recognize and to commend. And as WHO representative to the European Union responsible for partnership with the EU and EU institutions, beyond this initiative, I would like also to extend a special thanks to the European Commission and Team Europe for your unwavering commitment to multilateralism and global health. In today's geopolitical climate where multilateralism is often questioned and global health is challenged, having champions who support global health is crucial. And we are pleased to see that health continues to be a key pillar of Global Gateway Initiative with the investment the EU has made in initiative like MAF Plus being connected with this current program and delivering delivering very concrete results. And with all admiration to all of you, I'm also incredibly proud of my organization, the WHO, and my colleagues who through this program also exemplify the value and uniqueness of our mandate by leveraging our convening power, by setting standards, fostering accountability and health initiatives. And I would like to join Claudia also to call on all of you to continue to protect and support WHO. And lastly, I sincerely thank you, thanks to Belgian Minister of Foreign Affairs and Development, first of all, for hosting us here in this historic venue of diplomacy, but also for your leadership and health, which really matter in this invaluable time. In conclusion, let us continue to build on this momentum and collaborate and partner towards a future where global health matter and our collective efforts yield tangible results for all. Together, we can make a profound impact. I wish you a wonderful weekend. Thank you.
Thank you both to Claudia and Oksana for those remarks from the WHO. And I think as the words have been suggested, the presence of people here, the progress being made on this program, I think is a sure confirmation that we all believe in global health and the leadership of WHO. So thank you for being here and for your continued inspirational leadership. And I'll take this moment now to call upon Charles Gore, who's going to give his final reflections on this program. Charles?
Thank you, Zach. I'll be very brief as it's the end of the day. Just to your point, Manuel, the idea behind this really is some catalytic funding to de-risk future private investment. I don't happen to think personally that governments are the best people to be doing R&D. And that includes just directly funding it. I think in order to show that this is sustainable, we actually need the private sector to come in and say, yes, we see this business case. We want to invest in this. And that's what we're trying to do with this. And I think that one of the things that I found very interesting today was what Petra said about SAPRA, the South African National Regulatory Authority, coming to AFRIGEN and saying, we'd like you to train inspectors. And this is one of the many collateral benefits of this program that we weren't expecting, but that has really shown some of the ways in which a program like this, because of its concentration on equity, because of its, if you like, the mentality of the people involved in it, actually has these sort of benefits. It's one of the weird things that if you go into something with the right attitude, right things seem to happen. Now, you may all be thinking, oh, he's gone woo-woo on us. But actually, that just is my experience over 25 years in public health. And my last point really is there seems to be ever more momentum to this program. More and more people are offering to partner one way or another, whether it's you, Mohammed Gabriel, for example, or the University of Pennsylvania, and we'll hear from some others over the next few days. That really tells me that this program is working and doing what it said it wanted to do, and people want to get involved in it. And right at the beginning of COVID, there was lots of, oh yes, we're going to do this and we're going to do that, and there was a lot of talk. And what I think has been different about this program to many others is that we've just gone and done. And when I say we, I actually mean you, because all that we have done at MPP at least is to support you and facilitate you. We've not actually done the work. It's AFRIGEN and all the partners who've done it, and WHO. And so I do want to thank all of the people who have been really supportive to this. And you should all be incredibly proud in how far you've taken this. And we're just going to take it this one step further. And then we're going to go, there you go. We can do this from scratch to the end really successfully. And once again, very many thanks to Belgium for hosting us. Thank you.
Thank you so much, Charles, for that. And also, I believe, Manuel, the clarification on the 17 million has been given, really to allow for the facilities, the countries to be able to take this further, just to set the ball rolling, as they say. Thank you so much for that, Charles. And I also maybe just wish to take this opportunity to speak a little bit on something that Charles has just mentioned. I think the ability to reach a point in this program where the African Medicines Agency, which is supposed to be the continental regulatory body, coming to AFRIGEN and saying, please, can you do this for us? I think demonstrates trust in the process, demonstrates confidence in the capacity and the quality of work that is possible and that has been done in Africa and by local expertise. And I think this remains to be a pivotal moment in the program, that we can now reach a point where we have confidence being built locally. I think that speaks volumes to what the future could look like. So to Petro and the team and other program partners, I think this, as Charles has mentioned, this is an unexpected benefit of the program. We are, I think, reaping benefits even before we reach the finish line. So just wanted to emphasize that point that Charles brought up. And for the rest of, I think, us who have been watching this program, and those of us who have supported the program in many ways, financially, technically, leadership, governance, whichever way that the program has benefited, I think we all owe you a mountain of gratitude and a prayer, a request for a continued commitment to support this program, not just for the moral rightness of it, but also for the epidemiological importance that this program could have for the world in the next pandemic. I think this is quite literally, I keep saying this, but this is quite literally the biggest public health equity-driven initiative in play on this planet as we speak. And I think when you think about the potential in terms of number of people who could benefit from this program, especially when you compare with the amount of investment which has gone in, I think this is remarkably impressive. And everyone who's involved in this should feel significant pride and at the same time humility for being able to reshape history and redefine the future in public health as we see it and as we shall experience it. And especially for people who are coming from the global south, people who are coming from the low and middle income countries, where every dollar matters, every single dollar matters, because it means the difference, whether there's going to be, healthcare access, whether there's going to be vaccine access, whether there's going to be this and that. I think every dollar that all the partners or the funders put into this program is deeply appreciated and has been used, I think, very efficiently into this program. And already we are beginning to see the benefits that have started coming out even before we reach the licensure or the approval of the products that we aim to generate from these facilities. And taking the moment also to speak as a civil society advocate in public health, I think for many people who did work through the pandemic, I think we have a lot of hope when we look at this program, the way it is structured, the way it is designed, and the expertise that it presents currently, I think, has a lot that could change the world in a very positive way. And I say this with as much admiration as I possibly can have to WHO, to MPP, to Afrigen for being the very first to really step into this limelight, and to the other partners, the sites that have come on board, to everyone who has been involved in this. Thank you so much, and please let us continue and let us push to see this program to where it is supposed to be heading. And please do not relent in this effort. We are very, very close to putting a stamp into history books. When the next cohort in the next 10, 20, 30 years, cohorts of masters in public health students will be looking at how the world responds to pandemics, this is among the case studies that people are going to be looking at. These are going to be lessons in medical schools around the world in terms of what true global health really looks like and what true global health partnerships look like. And every country, every funder, every individual involved in this program should be very, very proud that we are quite literally reshaping how the world thinks about equity in health, how the world thinks about global health as it should be. And not to go any further than this, I would like to take this rare opportunity once again as I express our gratitude for your hosting us in this very, very beautiful, beautiful place, to call upon you once again as you open for us to give your closing remarks as our host, and I call upon Bart Penouat, who is the Deputy Director for Development Cooperation and Humanitarian Aid, the Government of Belgium. The floor is yours. Thank you.
Thank you, Dr. Kafuko. I gather I'm standing between all of you and dinner, so I'll keep this brief. 3 quick thoughts. First, I second Dr. Gore and indeed you, Dr. Kafuko. Let's be proud of where we are. Humble, but proud. So today marks, we believe, a real step towards phase 2, right? So we've heard strong commitments. I think together we're working hard towards at least 10 manufacturers by 2030, with the potential to deliver up to 2 billion doses when the world needs them, right? So the hub, the MPP hub, and technology sharing is what brings us here. They are about equity. I thank WHO for its leadership and MPP for its coordination. Our appreciation also goes to the CDC, Africa CDC, to Dr. Mosaka Fala in particular. Now, to keep this global initiative strong, we must ensure it remains driven by member states, and that takes me to my second point. National ownership does indeed matter. We know that it is key to long-term success. Countries must invest in regulation. They must invest in clinical trial capacity, in skills and in workforce. And Belgium is committed to do this and supporting the wider ecosystem, as is, I believe, Team Europe. This is really the only way to make a program like this truly sustainable. Third, phase 2 is indeed strategic. It goes beyond the pandemic response. It focuses on sustainability even between pandemics. So let's also continue to scrutinize what it takes to get products to the market, including profit margins, and make sure that at the same time access remains fair. Again, we salute the WHO and MPP for already thinking ahead about the program's future. For us, clearly, this platform is a global public good, and it is built by all regions, contributions by all regions. So finally, as Belgian Development Cooperation, we see real value in funding in order to unlock investment, so both public and private investment. And this program is an excellent business case. So it brings together partners from all ends, and it helps to activate a full ecosystem. So voila, thank you again for coming to Brussels, for choosing international cooperation. I wish you good conversations this evening and the days ahead, but especially enjoy the dinner ahead tonight. Thank you so much.